Almighty God, by whom alone kings reign and princes decree justice, and from whom alone cometh all counsel, wisdom, and understanding, we, thine unworthy servants, here gathered together in thy name, do most humbly beseech thee to send down thy heavenly wisdom from above to direct and guide us in all our consultations. And grant that we, having thy fear always before our eyes, and laying aside all private interests, prejudices, and partial affections, the result of all our counsels may be to the glory of thy blessed name, the maintenance of true religion and justice, the safety, honor, and happiness of the Queen, the public weal, peace and tranquility of the island, and the uniting and knitting together of the hearts of all persons and estates within the same in true Christian love and charity, one towards another, through Jesus Christ our Lord. Amen.
This Honourable House now resumes its sitting. Call of the roll.
Mrs. Holness, Mr. Bartlett, Mr. Holness, Dr. Clark, Dr. Chang, Mr. Montague, Mr. Shaw, Mr. Samuda, Ms. Grange, Mrs. Williams, Mrs. Malawu-Fort, Dr. Tufton, Mr. Mackenzie, Mr. Chuck, Mr. Vaz, Mr. Warmington, Mr. Hutchinson, Mr. Charles, Mr. Green, Mr. Terry Long, Ms. Smith, Mr. Main, Dr. Dunn, Mrs. Cuthbert-Flynn, Mr. Morgan, Ms. Davis, Mr. Brown, Dr. Brown-Burke, Dr. Charles, Mr. Chin, Mr. Clark, Mr. Cousins, Ms. Crawford, Ms. Daly, Ms. Davis, Mr. Golding, Mr. Graham, Dr. Guy, Ms. Hamilton, Ms. Hannah, Mr. Henriquez, Mr. Henry, Mr. Hilton, Mr. Jackson, Mr. Lawrence, Ms. Lee, Mr. Miller, Ms. Morrison, Ms. Nita, Mr. Paulwell, Mr. Phillips, Dr. Phillips, Mr. Robertson, Mr. Robinson, Mr. Sibbles, Mr. Slowly, Mrs. Vaz, Dr. Wheatley, Mr. Williams, Mr. Wilson, Mr. Witter, Mr. Wright.
House Leader, I think it is intended to go into the sectoral debate. Go ahead.
Madam Speaker, at this point, I would wish on the public business to have the sectoral debate continue. And today, we will have presentations from the Honorable Dr. Christopher Tufton, Minister of Health and Wellness, and Dr. Angela Brown-Burke, Member of Parliament, South West St. Andrew Opposition Spokesperson on Education and Training.
Members, the question before the House, therefore, is that the standing orders be suspended to allow us to move to public business instead of following the agenda straight and go into the speakers of the sectoral debate. Those in favor? Those against? The ayes have it. Dr. Tufton, can I invite you? Wait. Dr. Tufton, I crave your indulgence one moment. Members, you were given the posters yesterday on the UN Global Road Safety Week. I want to remind everybody that the UN Global Road Safety webinar starts tomorrow at 9:30. The Prime Minister is the guest speaker, and each member of Parliament will have a link to join the webinar tomorrow morning at 9:30. So the clerk will have all of us have the link for the webinar tomorrow morning at 9:30. Thank you very much. Dr. Tufton, over to you.
Thank you very much, Madam Speaker. Madam Speaker, 2020 has been an extraordinary year for Jamaica and indeed the world. The COVID-19 virus and its impact globally and on Jamaica has been life-changing. This, Madam Speaker, has been a once-in-a-100-year experience. There was no playbook prescribing a response. We had to adjust and learn as we went along. This public health threat tested our strength as a people, our leadership as a government, our resilience, courage, and public health expertise and infrastructure. We all witnessed, in disbelief at times, shutdowns and restrictions on communities, workplaces, schools, critical gatherings such as worshiping at our church, celebrations for weddings and birthdays, and even mourning our loved ones at their funerals. Madam Speaker, life changed dramatically for us on Tuesday, March 10th, 2020, when the first case of the coronavirus was announced here in Jamaica at approximately 12:15 in the afternoon. 13 months on, and the statistics continue to mount. Over 800 deaths and close to 50,000 infections up to May 15, 2021. Madam Speaker, please permit me to place on record my sincere condolences to the victims of the COVID-19 virus and their family members and friends. I am sure that the country and this House mourns with them, and our prayers continue to be for their strength and their guidance. May their souls rest in peace. Permit me also, Madam Speaker, to ask this Honourable House to thank and applaud the approximately 37,000 healthcare workers in the public and private sector and our local, bilateral and multilateral partners for the hard work and sacrifice that they have made to protect all of us from this not-so-novel coronavirus. In appreciation and gratitude for the unwavering dedication to the fight against the COVID-19 pandemic by healthcare workers, 2021 has been designated the International Year of Health and Care Workers by the World Health Organization. Here in Jamaica, Madam Speaker, I am sure we all agree, we embrace and celebrate our healthcare heroes. And just a symbol of their representation, Madam Speaker, we have with us in the gallery Nurse Marcia Thomas Yetman and Dr. Sandra Hill Cameron, both who have served over 20 years in public health and who have been on the front line of the COVID pandemic response. We celebrate them and all that they represent. Allow me also, Madam Speaker, to say a big thank you to the Jamaican people. In the midst of fear and uncertainty, they remained steadfast in their support of the government's efforts, which resulted in the spread of the virus being less than initially predicted. Madam Speaker, no health system or infrastructure anywhere in the world could have prepared for this public health catastrophe. We have seen many more advanced and more well-resourced countries buckle under the pressures of demand for doctors and nurses, hospital beds, oxygen, and even morgues to house their dead. Here in Jamaica, we struggled at times, but we were never so overwhelmed that we were unable to respond. This government worked with the people for the protection of the people, and the people responded on September 3rd, 2021 with a mandate under the leadership of Andrew Holness to continue our stewardship to chart us through these challenging times. I want to pause here, Madam Speaker, colleagues, to therefore express my thanks and gratitude to the Most Honorable Prime Minister, Andrew Holness, for his reappointing me to this position as Portfolio Minister. A difficult task, but a unique opportunity to continue after 4 years in this position. I say thanks to him for his confidence. I also want to say thanks to him for assigning me my State Minister, who sits, Madam Speaker, to my left. You know, Madam Speaker, I brag to my other colleagues that I am the only minister with a world champion who sits beside me and gives me protection. She has been a tower of support, and I am really happy for her and happy that she is with me and she's committed and dedicated. And I thank the Prime Minister for appointing her, and I thank her for her dedication and her hard work. Madam Speaker, I want to also pause to thank the people of West Central St. Catherine, who unfortunately, because of the situation, they could not be here today. They are the ones who have caused me to be here, and this government to be here by extension. And they returned me to provide service to them with an increased majority of almost 5,000 votes. The challenges are there. COVID has been a distraction in many cases, but I want to say to them, I love them and will continue to represent their best interests. Madam Speaker, I also want to say thanks to the health team. The health team at the Ministry of Health and Wellness, but across the length and breadth of Jamaica. And I want to single out in particular the Permanent Secretary, Mr. Dunstan Bryan, and the Chief Medical Officer, Dr. Jacqueline Bisesa Mackenzie. You know, it is very rare in my professional life, Madam Speaker, that I work so closely with individuals. And I tell you, over the last year to 13, 14 months, I've worked extremely close with those two individuals and their respective teams. I've benefited from their counsel, and sometimes I've had to do a little counseling myself. But in the end, we have worked things through, and I want to recognize them for their efforts, for their dedication, and for their commitment to this cause. I want to also use the opportunity, Madam Speaker, to say that never before, in my own estimation, and I thought about this last night as I looked over the presentation, has public health within this position in this country, where it is the most current and topical issue in terms of policy, in terms of everyday life, in terms of the direction and the decisions that we make. And in a sense, we're in a unique position. There is no indifference or neutrality when you talk about public health. We conjure up and attract very extreme sentiments. So it's either we are praised and thanked for the work that we do, or we are vilified and criticized for the decisions that we make. In fairness and for the record, the government makes the decisions as it relates to policy, but clearly benefit from the advice of the public health team. And what I'll say for the record in this House is that at no time at all have we in our deliberations, even when they are contentious, ever taken a decision or recommended or given advice that runs contrary to what we believe is in the best interest of the Jamaicans. I want to also, Madam Speaker, say thank you to a small team. They know who they are, and they have been my counsel, and I've depended on them for advice, and I just want to say thanks to them. And finally, but not least, my family. You know, the last year has been very challenging as it relates to family. And, Madam Speaker, while we as public servants sign up for scrutiny, for criticisms, for even rumor mongering and gossip, our family members don't. And I want to just publicly say to them, thank them for their support, thank them for their love, and I will always be there to give them. Madam Speaker, COVID-19 remains a clear and present danger to our population and indeed to the world. This government will remain committed and sincere about calling the issues as we see them and taking decisions that are in the best interests of all the Jamaican people. Our mantra has been balancing lives and livelihood. The Honourable Prime Minister has said it several times. So we consider all issues and individuals when the government makes decisions. But let it be clear, we have never compromised on the protection of the lives of the Jamaican people. COVID-19 may have dominated our time and attention in the last year, but our public health system and healthcare workers stood up to the task while continuing to respond to other health challenges faced by the Jamaican people. In other words, we didn't spend the last year just dealing with COVID, because there are so many other things that we were doing prior to COVID, and those things had to continue. I give you a preliminary data on some of the things we have done, just to show the commitment that was required to do everything at the same time. Madam Speaker, we had 2.8, and I'm rounding the numbers, 2.8 million visits to public health facilities compared to 3.3 the year before, 2019 that is. We had 1.8 million visits to our health centers compared to 2 million 2019. We had 1 million visits to public hospitals compared to 1.2 the year before. And yes, there was a decrease, and I'll explain that decrease later on, shortly. We also, Madam Speaker, had total surgical operations increased, actually, in 2020, 52,000 approximately, compared to 34,000 the year before. 145,000 admissions for care and assisted in delivery of 34,259 births. We provided public health, that is, Madam Speaker, some 289,000 diagnostic imaging services, including X-rays, CT scans, and MRIs. And we did almost 8 million lab tests during the last year. Madam Speaker, the team worked hard, not just on COVID, but on providing general response to the population. But we did have some reductions, and those reductions we tried to restructure and compensate for to ensure that the Jamaican people maintained full attention. So, for example, we use telemedicine for continued care of patients previously seen in the hospital, outpatient clinics, and health centers. Indeed, Madam Speaker, we would, the doctors that is, having prescribed a patient that had a chronic illness, instead of giving him a prescription for 1 month, we'd give them a prescription for 2 months. So there would be no need for them to revisit twice over a 2-month period, particularly with our older patients based on the doctor's advice. Some services were curtailed. For example, in the dental area, we used our dental staff to provide direct COVID response, 268 of those, and therefore, yes, we have had some backlog there. But overall, Madam Speaker, colleagues, our 2,452 doctors, 5,153 nurses and midwives, 1,471 paramedical and allied workers, and over 8,000 administrative and support staff represented an 18% increase in public health workers. This government increased the complement of public health workers in order to deal with the COVID response over the last year. We did more, though, Madam Speaker, because in 2019, September, having recognized the shortcomings within our hospital system for diagnostic services, we launched the Public-Private Partnership Enhancing Healthcare Services Delivery Project. During the last year, we used that project, Madam Speaker, to provide some 22,500 tests at no cost to those persons who were doing those tests. Previously, when a patient went to a public hospital and the MRI machine wasn't working or the CT scan, they were given a piece of paper and sent to go do it privately at their expense and then take back the results for the doctor to diagnose and to treat. This program said that you don't have to pay. We paid the private provider, and some 22,500 tests were done at a cost of 900 million Jamaican dollars. Madam Speaker, while the COVID-19 pandemic continues to be a major health threat to us all, we must also take time to see the opportunity that exists to reshape our current healthcare system, strengthen our resilience, and restructure our arrangements to build back stronger. Historically, Madam Speaker, we have seen where crises have forced countries and individuals to engage in alternative and innovative ways of doing things, and to imagine and reimagine and construct a better future for themselves and for the collective. COVID-19 must also be seen as our opportunity to make healthcare stronger and more resilient for the people of Jamaica. You know, Madam Speaker, personally, I have learned from this experience that life is fragile. Something we all must accept. We're here today, we're gone tomorrow. We've seen many persons go that route, and tomorrow could be us. However, we can improve our life chances through lifestyle changes and restructuring and structuring our society to enhance our health profile and reduce our vulnerabilities to health threats. I would like us to appreciate, even though it appears counterintuitive, because we have viewed COVID as a threat, and it has been only about the negatives. I would like us to examine a few of the positives that have flowed through, that have come out of the COVID experience so far, which hopefully will cause us to be hopeful for the future. For example, Madam Speaker, public health had a crisis management plan that provided the framework for managing this global pandemic long before the first case of COVID-19 came to Jamaica. It provided the basis for a more detailed and tailored plan to deal with this pandemic, which our team, led by the Permanent Secretary and the Chief Medical Officer, put in place. We took early decisions, and those decisions paid off. We learned from this pandemic and strengthened that plan for any future occurrence. Madam Speaker, that is a good thing. We are stronger based on the experience of COVID, and will ensure we have a plan in place to deal with any other future threat similar to this particular pandemic. Our surveillance capacity worked well and showed that whether it is a dengue outbreak or a global pandemic, the likes of COVID-19, we have the capacity to monitor and conclude on the issues to respond effectively. Surveillance, Madam Speaker, is the brain and nervous system of Jamaica's response to public health threat of the COVID-19 pandemic. It provides crucial ongoing data from a variety of sources such as hospitals, communities, and laboratories. Using our effective and well-trained team on the ground, we track the numbers, analyze the trends, and presented the data in a structured, understandable way for decision-making in response to the pandemic. Between 2020, Madam Speaker, and May 2021, the public health team, working with the Jamaican people, conducted over 95,527 contacts. This is the contact tracing, identifying people who are at risk or who had contracted COVID, tracking their movements, determining who they were in touch with, testing, 95,000 over a year. It took a lot of work at the community level to do that. Our national epidemiological surveillance system has effectively provided us with crucial information for us to quickly respond and to save lives. I want to say here that we in this House and the Jamaican people all should be proud to be associated with a team of dedicated experts led by our national epidemiologist, Dr. Webster Carr. From my perspective, they are second to none, and they are stronger for the COVID experience. That's a good thing, Madam Speaker, and something we should build on for the benefit of the Jamaican people. Our hospitals and their management teams of CEOs and SMOs, directors of nursing, supported by the Ministry of Health and agencies such as the National Health Fund, demonstrated that we can respond to an exponential threat. Between January 2020, Madam Speaker, and March 2020, when our first case was discovered, those very members in the public health system, the hospital management, had put in place 163 COVID beds by the March 23rd. March 10th was the first case. And currently, we have over 723 COVID-designated beds, including our field hospitals that are prepared to deal with persons who need that kind of care. We have more than that. We have 26 HDU ICU beds, over 40 ventilators. Madam Speaker, the public health system is more resilient and stronger as a result of this experience. In fact, the public hospitals admitted over 7,700 COVID or suspected COVID cases in 2020, representing about 5% or so of admissions. Over 7,500 of that number were treated and sent home back to their families. That's an indication, Madam President, of, Madam Speaker, a 1.8% mortality rate with a global average of some 2.2%. Our track record, Madam Speaker, is better than the world's average in terms of treating patients. Tribute to our public health workers. We had over 2,000 primary care personnel across the island involved in contact tracing efforts in the communities, including medical officers of health, public health nurses, public health inspectors, contact investigators, and community health aides. They are better for the experience of COVID-19. As a result, as a country, we are better off, and we must now build on that experience. Madam Speaker, I want to speak briefly on communication. And I say so in what I'm about to say, say it with absolute humility, but I want it to almost be a teaching moment, particularly for those who have been critical of our communication strategy as we seek to confront this COVID response and keep the public informed. Madam Speaker, over the past year, a major point of learning has been the fact that if the interventions and programs related to health are to be successful, the state must have the trust of its citizens. This is even more important in a crisis. Madam Speaker, trust is the currency of any crisis. If the people don't trust you, they won't listen to you. Strategically, it has not been easy in this COVID response to maintain and sustain this trust, as we are constantly bombarded by conspiracy theories, misinformation, and other distractions from the core messaging of prevention and being safe. You know, people have chipped in the vaccine. COVID is a conspiracy theory. It's an attempt to, and I could go on and on, Madam Speaker. A major factor that cannot be denied is that public health has attempted to build that trust. As we look to breaking the back of this pandemic and building resilience within the health system, we cannot underestimate the need for investments in the building of trust. The fundamental to this end is the development and management of open, honest communication with the Jamaican people. Madam Speaker, as a ministry and as the minister, I can't guarantee that every news we give will be good news. Clearly, we call it as we see it, but it will always be honest and forthcoming, because that is what builds trust. In this regard, Madam Speaker, our commitment is to constantly invest in the building of the trust capital through strengthening critical communication channels, strengthening our information points in traditional and non-traditional media, and reaching you directly within your communities and homes. Open and honest communication is the hallmark of good governance and is the linchpin of any successful health strategy going forward, Madam Speaker. So, you know, Madam Speaker, I know I'm accused of being the PR minister. I've seen it, I've heard it. Well, you know, I take that title as a badge of honor. As a badge of honor. And I'll say to those who have objections to it, somebody once said, let that sink in. I enjoy being the PR minister. Because in a crisis, if people don't know, they won't know what to do. And what we'll do is create confusion. Madam Speaker, our future as individuals and as a country will be better as a result of the lessons learned from the COVID experience. And this must be our mantra. Time to share and reinforce the good things from the COVID-19 experience. Time to be hopeful and renew and build back stronger. This is what this government is all about, Madam Speaker. Now is not the time to be afraid or uncertain about our future. We are in good hands. We are in safe hands. Andrew Holness, as Prime Minister, with the Cabinet of Jamaica, and my colleagues on this side, with the support of my colleagues on that side, we can lead this country back and back stronger and overcome the COVID strength. And we know that Jamaicans want to hug up again. They want to get together again. And our mission is to provide an atmosphere and an environment that allows them to do that. And we want them to believe that we can. And that is why it's important to communicate and to let them know what's happening. Madam Speaker, members may recall that even before COVID-19, this government tabled a 10-year strategic plan in the year 2018 for the renewal and the rebuilding of public health in keeping with our Vision 2030 document and the United Nations Sustainable Development Goals. I announced that a year and a half or so ago. That is the IDB-sponsored project, which would lead to expansion in certain critical infrastructure. Today, I'm giving, Madam Speaker, as part of that hope for the future, an update on where we are as it relates to that project. Members will recall that the government committed a significant capital expenditure of between $205 million US and $236 million US over a 5-year period for infrastructure, hospital and health center build-out. I'm pleased to report, Madam Speaker, that under this program, which is the Health System Strengthening Program, 11 of 13 facilities have been designed and are being reviewed now for final approval to move to the next stage for building out. These include, Madam Speaker, the Spanish Town Hospital, the St. Anne's Bay Hospital, Maypen Hospital, and in addition, we have completed external upgrade designs for the University Hospital of the West Indies and also the Cornwall Regional and Western Children and Adolescent Hospital in Montego Bay, though that build-out will continue over time. Madam Speaker, let me just give you a synopsis. On the screen, there is a full list that involves several other entities, but let me give you a synopsis of some of the major ones. The Spanish Town Hospital. The Spanish Town Hospital, a Type B facility, has started to benefit from a $2.3 billion upgrade, and we have completed now the designs of the new look Spanish Town Hospital. And that's how it's going to look, Madam Speaker. At the time of its establishment in 1952, it had a 220-bed capacity. The hospital now has 431 beds. However, the population expansion in and around St. Catherine and that community has caused significant overcrowding in that institution. With this upgrade, Madam Speaker, new services are going to be added to the Spanish Town Hospital, including urology, oncology, cardiology, gastroenterology, ophthalmology, and psychiatry will all now be offered in the new look Spanish Town Hospital, Madam Speaker. And by the way, that's not just an artistic sketch. That's how it's going to look when we are completed. That was taken directly from the architects who are working, and we are well advanced. And at a future date, we will unveil all the plans and what it will mean for the people of St. Catherine. Madam Speaker, the St. Anne's Bay Hospital, a Type B facility, has started to benefit from a $545 million upgrade, also in the design stage. The hospital was built in 1929 with an initial capacity of 15 beds. The hospital now has some 308 beds. Like Spanish Town, expansion of the area, greater demands on the system, not much change in the infrastructure. The new upgrade will include physical and functional reorganization of services, a new outpatient block, expansion of radiology, and a new intensive care unit. Madam Speaker, St. Anne and its environs are going to benefit from a new look and a better resourced St. Anne's Bay Hospital, and we will unveil the designs for that in short order. Then we go to the University Hospital of the West Indies, Madam Speaker. The University Hospital of the West Indies has started to benefit from a $4.9 billion upgrade of building and equipment, again, now in the design stage, and that's the actual design. That's not just an artistic sketch. Madam Speaker, a Type A hospital, the University Hospital, was established in 1948 at an initial bed capacity of 200, now increased to 554. The upgrade will include a new 6-story, 120 square feet medical facility, which will accommodate an additional 40 medical and surgical beds, improvements to the outpatient or ambulatory surgery, lecture rooms, conference rooms, and upgrading of the cardiology hybrid intervention surgery room and the neonatal intensive care and administrative department. Madam Speaker, the new University Hospital, Cabinet in fact just approved 3 weeks ago or so the resources to complete payment for the design. And once that is done, this is the external look. The ring road is going to be adjusted. The entrance to the facility is going to be adjusted. But the University Hospital, which is our primary tertiary level hospital for teaching and research, serving not just Jamaica but the Caribbean, is going to have a new look in the years to come to benefit the people of Jamaica and the Caribbean. That is building back stronger, Madam Speaker. Madam Speaker, Western Jamaica, in particular the Cornwall Regional Hospital, has been a source of many challenges related to the main hospital building. This has been a classic case of what happens when you don't maintain your infrastructure. And I'm not prepared to take responsibility on this side for that burden, as some would like us to believe. Because the truth is that hospital, that facility has suffered from chronic neglect over many, many years. And some of the indicators of collapse, and I've seen the documentation, took place when we were on that side and they were on this side. But having said that, not blaming anybody, the truth is, facts are facts. The facility has suffered from major neglect. And we have to fix it. Madam Speaker, let's be clear. Even as we fix the hospital, The services being offered have continued, and that is what is most important at this time to the citizens. Because this argument about repairing and no consideration for the fact that the doctors and nurses continue to serve the people of Western Jamaica is unfortunately doing a disservice to those doctors, nurses, and their support team. Let me give you a little statistics on Cornwall Regional over the last year to show that work is taking place in terms of service provision. 12,600 admissions, of which 7,500 were A&E admissions, performed over 8,000 emergency, elective, and outpatient department services. The hospital did over 300 inpatient operations, 1.3 million lab tests, 10,980 hemodialysis sessions, and over 8,000 chemotherapy procedures, and delivered over 3,000 babies over the last year. Madam Speaker, I want to thank the workers, the healthcare workers and their support staff who work at the Cornwall Regional Hospital, and I want to say to them that it will be bigger, better, and stronger in the next year to 2 years. We are now entering phase 2B of the project, which will include demolition and structural repairs to floors 1 to 6 and installation of roof on floors 3 to 6. We're also now making preparations, Madam Speaker, to go to the international market for a contractor for the third and final phase to totally rehabilitate and equip all 10 floors of the Cornwall Regional Hospital. Madam Speaker, when this process would have been complete, I'm saying we won't make the same mistake twice. Once we are providing the policy guidelines to that institution and public health. Cornwall will restore its pride as one of the finest Type A facilities in the region. The upgrade will include advanced and completely digitized diagnostic services in keeping with the current international health standards for infrastructure. At the end of the process, we will also have an effective building management system to allow for up-to-date and advanced maintenance services, and all major plants and equipment will be properly managed, Madam Speaker, and a new spatial structure will allow for better infection prevention and control. Cornwall Regional will come back, and it will come back stronger for the people of Western Jamaica. Madam Speaker, Western Jamaica will also benefit from the construction of the Western Children and Adolescent Hospital, thanks to the generosity of the Chinese government. And that is actually a final look of what that facility will be when it's completed. COVID-19 understandably created some delays, but I am happy to report that the Chinese construction team are now finalizing plans to be back in the country over the next 6 or so weeks, and will begin shortly after. The hospital has a 220-bed capacity, and adolescent hospital will be the only one of its kind in the Caribbean region. It will be the only hospital, Madam Speaker. Bustamante is up to 12 years old. Western Children and Adolescent will be up to 18 years old, and the only hospital in the Caribbean that will treat 12 to 18 adolescent population in a very specialized, focused environment. The hospital will boast pediatric intensive care and high dependency care units, and will have the first pediatric emergency department on the western side of the island. It will also cater for the pediatric population with specifically designated outpatient service, a dialysis unit, and lab services, and cater to the adolescent age, as said earlier. The complex will also, very importantly, this complex, generous gift by the Chinese, will also provide modern housing for healthcare workers who work in the hospital, a major incentive. Madam Speaker, we're building out this infrastructure, and these are only but a few. If you look in your printed copies, you will see a list of other infrastructure development, like a health center in Old Harbour, over $400 million, now in the design stage. In Portmore, in St. Anne, in Clarendon. Huh? Madam Speaker, a significant number of infrastructure that are slated under the IDB project. The Greater Portmore Health Centre, St. Jago Health Centre, Old Harbour Health Centre, Maypen, West and East Brownstown Health Center, St. Anne's Bay Health Center, Ocho Rios Health Center. Madam Speaker, the resources are in place. The designs are almost complete. And in the next year, or certainly during this period, you will see us breaking ground for the renewal of our infrastructure in public health. We are building back stronger, Madam Speaker. There is reason to be hopeful. But having built out all this infrastructure, Madam Speaker, we also have to ensure that the management systems within the infrastructure works and works well. And so I'm pleased to announce, again, under the leadership of Andrew Holness and this government, over the last 2 years, the government has been working on what is going to be the most significant investment in health information systems, $8.5 million in a digitized, integrated health information system, Madam Speaker. A multi-stakeholder National Health Information System Committee has been formed. And this is really what's going to happen. It's on the screen. Essentially, Madam Speaker, healthcare is going digital. That's really what it is. You go to the doctor at a hospital, you came from a clinic, the doctor uploads your information. You don't have to wait 2 hours to go find the paper-based file. It will have your medical history, which medication you are taking, what were your symptoms, how are you being treated, what are you allergic to, if you have x-rays, what those x-rays showed, and the doctor will be able to prescribe, having assessed you in a much more efficient way. It's about reduction of transaction time and cost for the benefit of the Jamaican people, and that is what health information systems will do. Madam Speaker, we're advanced with this, in that we're just about to sign a contract through the government procurement process with a provider to install the hardware, the networking of the institutions. We're starting with 3 hospitals and 9 or 12 health centers. We're linking the hospitals to the health centers within that particular area. The contract has been signed, will be announced soon, for the provider to put the hardware and the networking in place. And then we will go to market after that for the software to be placed for the hardware to give the support in order for the health information system to be put in place. Madam Speaker, there's reason to be hopeful about the future, because if we have that system in place, we can deal with the threats like COVID and other threats that we will encounter going forward. Madam Speaker, we are also going to do other things. Telehealth and telemedicine is our next big thrust. We are now in the process of identifying a vendor to gradually roll out home care and telemedicine. The ministry has also successfully implemented a tele-eco program to train healthcare professionals on best practices in chronic care. We have already trained over 1,000 healthcare workers in this area, Madam Speaker. We are preparing our healthcare workers for the next generation and for the future. We should be hopeful. Madam Speaker, perhaps the most profound lesson from the COVID-19 experience is the extent to which persons die from the virus because they were already sick. I want to repeat that because I think it needs to get across in the psychic of the Jamaican people. The persons who died from COVID, the statistics show, are persons who were already sick. I want you to look at the screen, Madam Speaker, because it's so important for us as leaders, as legislators, to lead this narrative. 1 in 3 Jamaicans have high blood pressure or hypertension. By the way, 40% of them don't know that they have it until it throws them down, until they get a stroke. They don't know that they have high blood pressure. 1 in 10 diabetic. 3 out of 20 or 15% chronic kidney disease. Many don't know it because they don't know their health status. They don't get the checkup as we know it as. They don't go to the doctor to do the regular routine checks. Deaths, Madam Speaker, from the COVID experience demonstrated and reinforced again that deaths were higher among those persons who were already suffering from lifestyle diseases, hypertension, kidney failure, heart disease, cancers, type 2 diabetes. Unfortunately, there's just too much of it in the population. Too many of us. And I say us because all of us are suffering from some ailment because of how we live and how we interact within our environment. Madam Speaker, we have spent much time dealing with COVID-19 and the pandemic, but prior to this, not enough time dealing with the epidemic of non-communicable or lifestyle diseases. That needs to be a lesson from the COVID experience, and that needs to change. And we need to lead that charge. It is significant. Our bodies and what we do with it and what we put in it over the years had a significant impact on how we responded to the COVID-19 virus. The foods we eat, our physical activity program, rest and relaxation, pollutants in the environment, are all contributors to our personal health profile. Madam Speaker, the term knowing your health status may have been a cliche in the past, but COVID-19 has taught us that it cannot be anymore. We must take better care of ourselves as individuals. And we say in public health, we need to be our own hero. We need to start thinking about ourselves, because if we do collectively, we will start thinking about each other. In that regard, Madam Speaker, I want to say something about consumer choice and the right to know. Our democracy promotes freedom of choice and indeed competition among lifestyle options within a regulatory framework that protects those rights in a transparent manner. That right should be enhanced by ensuring that our citizens have information to help them make informed decisions about the choices they make. I think we have a duty to ensure that our citizens are at least aware as they make the decisions around lifestyle. When consumers make choices about the foods they eat, they should do so knowing the risks and/or the benefits in consuming those foods, particularly if they are paying for it.
Madam Speaker, I now ask that the standing orders be suspended to enable the Minister to continue his speech to its conclusion, notwithstanding the time limit on speeches.
The question before the House is that the standing orders be suspended to allow the Minister to complete his presentation. Those in favour? Aye. Those against? The ayes have it. Minister.
Thank you very much, Madam Speaker, and I appreciate the same leniency that you have offered to my colleagues. I'm not pointing any fingers, Madam Speaker. I'm not pointing any fingers. But we'll wrap up soon. Madam Speaker, I was speaking about lifestyle and in the post-COVID era, and the right of consumers to know what's in their food as part of their fundamental right to good health. And I'm saying it must be highlighted if we accept that lifestyle is our primary risk. You know, let me draw a parallel here, Madam Speaker, to highlight the impact of lifestyle diseases. COVID-19 has so far claimed the lives of approximately 3.3 million people globally, just over 800 people here. On average, however, each year, over 40 million people die worldwide prematurely, meaning before the age of 70, from lifestyle diseases. And indeed, there's another chart that's supposed to be in your book. I was hoping it would go up on the screen, showing the breakout of the COVID-19 deaths in our country. I can remember the key statistic, which is that 74% of the deaths, okay, there it is. 3 out of 4 deaths of all the deaths in Jamaica from COVID-19 are 60 years and over. 5 out of 10, or 50%, have cardiovascular disease, which hasten their demise, and the rest is there. 9 out of 25, or 36%, diabetes, 1 out of 15, 10% chronic kidney disease, 1 out of 20 neurological impairment. The fact is the overwhelming majority of the deaths were caused by that lifestyle disease. And in the world, lifestyle diseases claim far more lives than COVID. Premature deaths, people before they get to 70. And the main driver, Madam Speaker and colleagues, has been unhealthy diets. Diets that are high in sugars, in salts, and in fats. Madam Speaker, as a government, we have an obligation to support initiatives that give our people the best chance of correcting this unhealthy trend. Indeed, we have committed to it. We may forget, but we have committed to it. We are signatories to the United Nations International Covenant on Economic, Social, and Cultural Rights, which recognizes the right of everyone to the highest standards of health, where there are other conventions that make it our duty to promote good health for our people, including Article 24 of the Convention on the Rights of the Child, which recognizes that all children are entitled to guaranteed rights to healthy food and adequate nutrition, and that the child and their parents should have access to nutritional information about their foods. Madam Speaker, the Jamaica Standard Act requires, and I'm quoting, every label on any container of processed food offered for sale must state all its ingredients. But it's not just about stating the ingredients, because I tell you, sometimes when you try to read what's on some of these brands, you have to have a chemistry degree to understand what it means. So the convention doesn't just call for stating it. The convention requires it to be understandable to the average man. And I tell you, we would betray our duty if we don't ensure that that is the case, both for ourselves personally and our families, but also importantly for the country. It is with this in mind, Madam Speaker, that the government is moving to establish baseline information on ingredients in processed foods, and will seek to use this information to provide greater consumer awareness as part of encouraging health-seeking behavior within our population. We have commissioned studies on salts, sugars, and trans fats in our foods. And it's important, and I think it's a duty on our part. Madam Speaker, I want to use the example of trans fats to explain why information is important for consumer choice. And remember, no, we're not forcing anybody to do anything, but we at least have a responsibility so people will know. Trans fats are produced when vegetable oils are chemically altered by adding hydrogen to harden the product and improve the shelf life, stability, and taste. Trans fat increases low-density lipoprotein, which is the bad cholesterol, and reduces the beneficial cholesterol, which is the lipoprotein high density. These affects negatively on cardiovascular functions. In fact, if you consume enough trans fats, your chances of dying will increase by 28% according to the clinical studies. Let me break it down. Enough trans fats will clog your heart and likely you end up with a heart attack. I'm not here to scare anybody, but I'm saying it. That's what the studies show. That's what the data shows. Coronary heart disease is a leading cause of death in Jamaica, Madam Speaker. This is through strokes and as well as strokes and diabetes. Now, the WHO recommends the elimination of industrial produced trans fats from the food supply and replacing them with healthy alternatives. And I tell you, we may not recall at this point, but Jamaica was one of the first countries in the Caribbean to join the Pan American Health Organization initiative to eliminate industrially produced trans fatty acids by the year 2025. So we have actually signed on to that. Last year, Madam Speaker, we commissioned a study in conjunction with the University of Technology to look at trans fats in our foods. And what we came up with is that of all the foods, and I have a list of the foods, but we just put the categories. So you have baked goods, breakfast cereal, beverage, chocolate mix, canned foods, and so on. I just put the categories, even though we have the brands, which we won't speak to. Let me give you the summary. The summary is that of all the foods that we have tested, and it was about just under 300 different brands, 39% contain trans fats, and 61% did not. It would be nice to know whether the ones that I purchase have trans fats or not, and I believe we'll all agree to that. We did the same thing with sodium, Madam Speaker, or salt, using the WHO standards of recommended salt intake, and it also showed some meeting the recommendation, others not. Madam Speaker, the action item here is that in the coming year, we will continue our drive to educate consumers on the dangers of unhealthy foods and push for lower levels of salts, sugars, and fats in our diets, and over time, in keeping with our decision we took many years ago, the elimination of trans fats in our foods. We'll also be pushing for labeling requirements that are clear and easy to understand, including front-of-package labeling, in the interest of protecting consumers' right to know and for good health. Madam Speaker, earlier this week we launched an initiative that was announced 2 years ago, a Better For You menu initiative, in conjunction with a number of restaurant chains in Jamaica. And what we have done, Madam Speaker, essentially is not unique to Jamaica. It's in other countries, but we created our own symbol. We did some focus groups some years ago under the Jamaica Moves banner, where we spoke to consumers and we recognized that people were eating less at home, changing lifestyle. You ate on the run, you ate on the road. And some of the favorite restaurants that are stated there are visited and you purchase your meal. Well, we brought them together and we had a discussion with them, Madam Speaker. And we basically said to them, why don't you work with us to design a symbol that you place on your menu board where you develop healthier options and you give the consumer the choice. If they have to go to chain X or restaurant Y, these are the options you have. And that symbol, the Better For You with the tick, is an indication that this represents the healthier option on that menu. Madam Speaker, I'm happy to announce that those restaurants agreed to come on board. And yes, there are perceptions around those brands, one way or the other. There are loyalties among those brands, one way or the other. Our issue is, let us start to nudge the consumer into start thinking about healthier options. This doesn't solve all the problems, and it's not intended to solve all the problems, but it at least is a start, and that's what we want as we build greater awareness. Well, over time, the intention is to expand that to traditional restaurants. So when you get your menu in hand, you can see the symbol on that menu sheet, and you can see what on that menu sheet is better for you compared to the others. Madam Speaker, it's important, and we are nudging and encouraging consumers to seek out healthy options. We're also saying to manufacturers and suppliers, let's work together to give consumers healthier options. In other words, Madam Speaker, it is good business to promote healthy living. It is great living to eat healthy. Good health begins with better choices, and that's what the Better For You menu is all about. And I want to commend those who have been part of the coordination and the development of that. Madam Speaker, working my way down now, I want to speak quickly on physical activity. Remember now, we're talking about curative measures, hospitals. We're talking now about prevention measures, which prevention is always better than cure. Madam Speaker, while nutrition is important to a healthy body, physical activity adds the strength and resilience we need to preserve quality of life. Physical activity can reduce the risk of major illness, including stroke, type 2 diabetes, heart disease, and cancer by up to 50%. Exercise can also lower the risk of early death by up to 30%. These are what the studies have shown. It's also very good for your mental health. Madam Speaker, in 2017, the Jamaica Moves was launched as our primary physical activity and, to a lesser extent, nutrition branded program. You know, Madam Speaker, we launched the Jamaica Moves in 2017, and I'm proud to say, working with the team, that it has received endorsement from CARICOM, the United Nations, the Pan American Health Organization, and the World Health Organization. this government and the Ministry of Health and Wellness and the team out of the Jamaica moves provided advice and support to establish Caribbean moves, Barbados moves, St. Kitts and Nevis moves, Trinidad and Tobago moves, all modeled off the Jamaica moves idea. And those are the logos up there, Madam Speaker. And I want to say, Madam Speaker, that the value of the Jamaica moves is not just in the physical activity program. I'm coming to that, because I knew you were going to ask. I'm coming to that. The value of the Jamaica moves is not just in the physical activity program. But importantly, the concept of Jamaica moves is to use culture and behavioral sciences to influence health-seeking behavior. In other words, Madam Speaker, the challenges that we face in Jamaica with lifestyle issues is not going to be solved through clinical science. It's not going to be solved through the prescription pad or the hospital bed or the emergency room. It has to be solved through behavioral sciences. It has to be solved through health-seeking behavior, getting persons to adjust lifestyle. And that's what the Jamaica Moves program did. That's fundamentally what it did. The success of the program also came from partnership, especially public-private partnership. And I would like to take this opportunity to thank, Madam Speaker, those who have been a critical part of the creation of the brand and what it represents against lifestyle disease. And let me give you some of the statistics. Over the 2019 to 2020 period, Jamaica Moves engaged with over 150 workplaces, promoted healthy lifestyle, hosted focus groups across the island, managed social media pages with daily original content, which saw 53% growth in followers, over 12 million impressions. What an impression is by social media standard, people see it, they look at it. And 183,000 engagements, having seen it and been exposed to it, 183,000 persons responded. So it has had an impact. I would like to announce today that the Jamaica Moves brand has been transferred and is now fully the property of the Ministry of Health and Wellness. Madam Speaker, I want to say that the brand was created, and I want to place on record because I appreciate all the distractions and, frankly speaking, the right to public scrutiny. So don't misread my intentions. We are all subject to public scrutiny. But I want to place on record that the Jamaica Moves brand was transferred from the company Market Me, the company that created the brand, coordinated its execution, including private sector support, and the company that worked up to this point with the Ministry of Health and Wellness, the NGO community, and private players to make this brand not just a Jamaican initiative, a regional initiative. And I want to place on record my thanks to Market Me and the other stakeholder partners for their efforts in building out this brand. I also want to say that the brand will continue to be the flagship brand of the Ministry of Health and Wellness physical activity program, as it is now fully lodged in the Ministry of Health and Wellness. I would also like to announce today that we are launching another program, a pilot software application program called Get Moving with Jamaica Moves. This is an app that you download on your phone. I want you to take a look at that because we have high hopes for that. This is around self-monitoring, Madam Speaker. You don't need to go to the doctor. The doctor is on your phone, okay? The app is part of our initiative to promote self-monitoring of personal health status by allowing individuals to check their blood pressure, blood glucose, weight, and stomach mass. Stomach mass, right? Stomach mass, or your gut mass. And Madam Speaker, input the data on the app on your phone to receive very importantly, to receive from your phone and the app health tips about your current health status. And Madam Speaker, I'm winding down, and I thank you again for I have a goodie bag here for every parliamentarian. Remember, ask me what's inside. Well, you're going to get a high-tech digital scale to stand on every morning. And if you want to weigh a little less, don't go at it when you're about your clothes. Wait just before you go into the bathroom. You're going to get a little home kit that allows you to check your blood pressure right beside your bed. Every morning you get up, you just, and it's all digital. So you know whether your blood pressure too high or too low, or just about right. And how can I forget measuring? Because, Madam Speaker, the most significant indicator, hold on, this is very important, the most significant indicator of obesity, which is the primary cause of those lifestyle diseases, is right here. And I'm not referring to it when it is otherwise engaged. I'm referring to it under normal circumstances. You need to measure that up. We also have information on your physical activity program. We're throwing a little skipping rope just in case you want to. And we're gonna add a home kit machine that checks your blood glucose level. So you prick your finger and you'll know whether or not you're prone diabetic. You want a bicycle? No, we can't afford that. You're gonna have to buy your own bicycle. But Madam Speaker, in seriousness, what we're trying to do and what I'm encouraging my colleagues to do is to let us become the agents of change in terms of lifestyle. Let's take the pressure off the system and off ourselves and off our families. You know, sometimes people say that, you know, them see me all over the place running on the road like I'm a madman, right? All right, listen. My best time in the morning is 5 o'clock. I make the time. And if it's walk, if it's run, if it's jog, all I'm saying is it's the best medicine that you can take in your own interest, Madam Speaker. So this program is about self-monitoring. And what the app will do, the app, once you put the numbers in the app is going to say to you, you are a little off, you need to go see a doctor if your blood pressure is too high, you are diabetic or pre-diabetic, the app is a doctor on call right on your phone. Now, I was hoping to launch it today, but we had a little glitch. And so you will get this package, but we will launch it in another month or so once we work that glitch out. And that is Jamaica Moves on the go in your home. Madam Speaker, in closing, I want to mention one final matter, and that's the issue of health financing. Madam Speaker, COVID-19 has not only taught us that we cannot take our health for granted, but also how important health financing is to building, sustaining a resilient health ecosystem. It is time we discussed and agreed on how to secure health financing in a sustainable way. You know, the World Health Organization recommends, Madam Speaker, that at least 6% of GDP should be spent on public health. In this country, we spend about 4%. And I understand why. I'm not here suggesting that we should deprive other people, but ideally, that's where we ought to go. And we have improved, by the way. Under this administration, health has gotten more of the budgetary pie, and certainly during the COVID period. And I want to thank the Prime Minister, the Cabinet, for recognizing and in their wisdom giving that support. But in a sustainable way, we need to get to that 6%. This is important to ensure progress towards universal coverage and healthcare systems capable of looking after the healthcare needs of our population without causing financial hardships or significant out-of-pocket payments. Madam Speaker, this country, and this is very important, must use the COVID-19 experience to come to terms by engaging in a frank debate and discussion around healthcare financing. We needed to do it long ago. We needed to do it long ago. I mean, I tell you, even as a parliamentarian, you know, we give of ourselves, and one day we need support, and it is challenging. Put it that way. I put it no stronger than that. But that applies throughout the country. So we need an all-encompassing review of the healthcare infrastructure. So we need to engage in that frank debate around healthcare financing. We can't sweep it under the carpet under the guise that it's too expensive. Indeed, it is too expensive not to have that conversation. The COVID-19 experience, and before that, the dengue outbreak in 2019, and the ongoing NCD epidemic and its economic and social impact on premature death, absenteeism from work, low productivity, revealed to us that aside from the personal pain and suffering from losing a loved one, poor health is just bad for national growth and for development. People who are sick can't work. They can't work, and they certainly are not going to be productive. Whether we want to call it health insurance, and we did table a green paper for discussion, didn't go very far because COVID intervened, we need to put it back on the table. Or whether we want to just call it health provisioning, whatever it is, it must be addressed, Madam Speaker. And so my own action plan to myself and my team is that in the next year, we're going to find a way to raise the temperature, the discussion around how we finance healthcare going forward in the future. Madam Speaker, COVID-19 has been the most significant health crisis in the world since the Spanish flu over 100 years ago. We should never allow such a devastating crisis to, in a sense, go to waste. We should never allow such a devastating crisis not to teach us lessons. As we work towards recovery and to building back stronger, we need to assess, we need to work together on both sides of the aisle, and frankly speaking, we need to ask the good Lord to give us guidance so that we provide the leadership at all levels. In the coming months, we are going to have to embark on the largest mobilization program as it relates to vaccines. Now, I haven't gone into vaccines and so on because we talk about it every week. I have a COVID press brief with my team every week. But strategically, from a policy perspective, we are going to get out of this if we get the country behind us. And I know where my Prime Minister is because he has called for that several times. I'm saying to my opposite and the colleagues on this side, this country, if it is to pull through the COVID pandemic and move forward to provide the opportunities for the people, we're going to have to work together around this vaccine thing. We're going to have to get every Jamaican who is cynical, every conspiracy theorist who's not sure what they're talking about, but they're talking anyway, to understand and appreciate that this is the only way forward. The government is very hopeful that we will have vaccines. There are some contracts signed, but the truth is the world has a challenge as it relates to production, and so it may be over the next few months we will see a trickle and then we see a significant number. The plan is to prepare to do what we did with the last blitz we had, the first blitz actually, and to do more. And I'm calling on every member of parliament and elected official, and indeed every leader in this country, private sector, public sector, to come together around ensuring that we mobilize the country. I want to thank all who have been a part of this process. I want to mention the National Health Fund, Mr. Mitchell, who is the chairman, Everton Anderson, the CEO, and the team, the private sector groups, the churches, all of us have to ensure that we redouble our efforts. I think we can do it, Madam Speaker. I think we have it in us. And I think the fact that we have survived 13, going 14 months, and substantially did better than a lot of other places in the world, we will survive the next number of months, and we will build back stronger for the benefit of the people.
Presentation or something.
Madam Speaker, colleagues, teachers, students, Jamaicans all. As I rise today to make my contribution to the sectoral debate, let me first thank you, Madam Speaker, for your guidance and graciousness. Colleagues, thanks you for your collegiality and for reminding me that we are here, all here, to do the people's business, and we are not on a frolic of our own. Let me also give thanks to the Lord, the giver and taker of life, for a peace that transcends understanding and a love that endures forever. Madam Speaker, I am humbled to have been given a second mandate by the people of St. Andrews Southwest to represent them and champion their issues in this honorable House. I commit to continue being faithful to their cause and to act with integrity and humility. I have also been fortunate to have with me in Southwest St. Andrew a solid team headed by my councillors Eugene Kelly, Carl Blake, and Audrey Smith-Facey. Members of my constituency executive, the chairman, officers, divisional executives, PD workers, cluster managers, area leaders, and residents from all 3 divisions. Today, I say thanks for your support and constant engagement, despite the challenges of Corona. Permit me also, Madam Speaker, to especially thank my office and support team, who have spent long, hectic days ensuring that we respond to the challenges facing us in Southwest. It has not always been easy, but with a grateful heart and cheerful spirit, we recognize that in the end, the King will reply, "Truly I tell you, whatever you did for one of the least of these my brothers and sisters, you did also for me." Madam Speaker, my thanks also to the opposition leader, Mr. Mark Golding, for entrusting me with the education and training portfolio, which allows me to stand before this honorable House looking at the state of education and training, where we are today, and the radical shift we need to make if we are to remain true to being little but Talawa. I must also thank members of my Education and Training Task Force, chaired by Mr. Michael Stewart, who have been of tremendous assistance as we engage educators, school leaders, parents, students to get a perspective from the field and to look at what is required in our education sector and for an empowered and educated nation. Last but not least, I thank my family, especially my husband and sons, who have stood beside me at every turn, and my sisters, who are often called upon to shoulder the burdens they did not sign up for, but they've always been there. Madam Speaker, before I look at the constituency, I want to begin my presentation by looking at the commitments and promises that Jamaica has articulated in Vision 2030 and which are in fact in keeping with the adoption of the UN 17 Sustainable Development Goals. And I quote, "Our country will develop an education and training system that produces well-rounded individuals, well-rounded and qualified individuals who are able to function as creative and productive individuals in all spheres of our society and be competitive in a global context." Madam Speaker, SDG number 4, Sustainable Development Goal number 4, is what we call the education goal. And there are many of us, me included, who believe that this is the most important goal. Why do we say this? Because once we have an education system premised on inclusivity and equity, with the mechanisms to ensure that what happens in schools to our children leads to equitable treatment of all our children, this in turn will reduce intergenerational poverty and help us to achieve equality across geographical and socioeconomic barriers. This type of education would lead to the creation of what we call the educated Jamaican, one who loves to learn, a lifelong learner, a critical thinker, resilient and able to adjust to different situations, one with a minimum requirement for higher education and training, a productive person in charge of his or her economic advancement. This educated Jamaican, the product of an equitable system, will contribute to national development by being socially aware and responsible, conscious of what is good for society, committed to a sustainable lifestyle, spiritually conscious and mature, tolerant of diversity, and rooted in his or her Jamaican smartiness. Madam Speaker, you will know that much of what I've spoken about in that profile really centers on what we call the affective domain. That's the one that deals with feelings, values, appreciation, enthusiasm, motivation, and attitudes. The P.J. Patterson administration referred to a similar program as values and attitudes. The Minister of Education in her presentation spoke about character education. Just to note, Madam Speaker, that both government and opposition at the time of the Education Transformation Report in 2004 agreed on the profile that I've just referred to. And in different ways while in government, both have tried to develop this laudable ideal of the educated Jamaican. So the question is, why haven't we been able to achieve this educated Jamaican? We have not been as focused on education as a number one priority as we should have been. Yes, I said it. Infrastructural development, tourism, and so on. All good things, and that is true, are the ones that we are focused on. And we understand, in a sense, why. However, without an educated Jamaica, we end up with second-rate performances, which lead to all the other ills in society that we have been talking about. We have also not placed consistent and sustained effort in going beyond this extraordinary focus on high-stake examinations and examination passes. We as a country have therefore missed the opportunity to treat adequately with the issues of feelings, values, and attitude, character education, And that is why, Madam Speaker, we welcomed the announcement to include character education in the curriculum. And in this regard, Madam Speaker, to you through the Honourable Minister, I just want to make two important points. One is that the affective domain, as we call it, is not taught. It's not taught, it's caught. It is caught, Madam Speaker, through a lifetime. It is learned by hearing, by seeing, by experiencing, feeling, thinking. It also has to be integrated into all levels of education, not starting at grade 1, starting from the basic school education level, early childhood education, in the formal setting, in our homes, communities, and through a rigorous parental education program. It is also caught, Madam Speaker, when individuals sit and listen to us in Parliament and measure our words with our deeds and the values that we say are important. The second is that for the impact that Jamaica is hoping to see, that we're all hoping to see, our education system would need to be repurposed and reoriented, as envisioned in Dr. Ray Davis's 2004 Task Force on Educational Reform Jamaica report. And similar to what we are expecting from Professor Orlando Patterson's report, which had been promised from last March. I gather there's a new deadline. Madam Speaker, this devastating state of our education system has had far-reaching consequences for our society and our economy, as it sustains a low-skilled, cheap labor workforce, unattractive to investments requiring high skills and paying high wages. To attract investments in Jamaica for badly needed sustainable growth and development and an improved quality of life for many, we simply cannot maintain the existing education system. The COVID-19 pandemic has served to uncover and perhaps remind us of the gross inequity and dysfunction of our education system. We are now faced with the urgency of fixing what is a fundamental aspect of building a cohesive society, ensuring progress and prosperity for the majority, not just a few. Madam Speaker, the government's response, led by the Honourable Minister of Education to COVID-19, has perhaps unintentionally ended up widening the divide that existed before between the privileged 20% of our students and the rest of the population. Among the rest are the disenfranchised, the underqualified, and those unable to earn a livable wage, become self-employed or set up their own businesses, access further education, or contribute as productive and fully functional citizens. If we are to be honest to ourselves and to those who have elected us to serve, then we have to acknowledge that we have seen a tardy, partial, and inadequate response from the government. Failing to engage stakeholders in a strategic, targeted response to provide service devices and connectivity, years of delay in the distribution of tablets to the most needy, even the Own Your Own Device program has not gone far enough to make a significant dent. And we have to talk about what are some of the underlying issues so we can deal with those. We have also seen impromptu and pronouncements regarding the return to school for face-to-face teaching and learning. We have seen a lack of any broad-based consultation with school leaders, broad-based consultation. We have seen a disregard in many ways for their competencies, which have been sharpened by the many measures that they have developed during this pandemic and are successfully undertaking in their local schools. There's a lack of a systematic purposeful engagement of parents and a clear indication at what we believe is an untenable position from the ministry that one size fits all. Madam Speaker, to make matters worse, the children that are in the early childhood sector have been left to drown. The response or lack thereof from the government seems to have basically abandoned the many years of partnership with early childhood and basic school operators who have worked to prepare our children from the least able and underserved families with the basic skills necessary to transition to the next phase of education. At the same time, many parents with children with disabilities are at a loss. They feel as if they have been forgotten, neglected, denied the basic right to education. Madam Speaker, the many attempts by private school providers to get government to seriously consider providing some help to the families of children affected by COVID have been ignored. Simple requests to assist institutions with training required to adapt to our COVID reality have also been ignored. An earlier request by the opposition for the government to provide incentives or to look at ways of assisting private school operators to keep their doors open fell on deaf ears. There seems to be a refusal to see our private institutions as important strategic partners in education. I think our children deserve better. The toing and froing, pep is on, pep is off again. The representation at CXC by the ministry officials and the Honourable Minister about what should happen with 2021 CSEC and CAPE exams have certainly showed up the lack of strategic thinking about what is best for our children at this time, about the clarity about what obtains on the ground. Make no mistake, we know that coronavirus is novel and that there's no blueprint on how to operate in these circumstances. We acknowledge that. But that is precisely why collaboration with all stakeholders is imperative. Madam Speaker, while we only want to see the best teachers in the classroom, because we know that the quality of an education system cannot exceed the quality of its teaching. We know that. We also know that this pandemic has challenged even our very best teachers. And here I pause to say thank you to the many, many teachers who have set up classrooms online, taught classes, sometimes with intermittent service, who have done the research and experimented with ways of engaging students, those who have put their creativity to the test, those who have put their psychology and counseling training to work, and have gone the extra mile to reach and motivate our children, those who have been forgotten by the system. Madam Speaker, our teachers need to feel respected and valued. So our focus must be on the effectiveness as well as showing appreciation for their efforts. Based on my interactions with the hard-working and committed members of the teaching fraternity, I am convinced, I really am convinced, and the Minister and I have had this conversation before, that the Ministry of Education needs to either revisit its understanding of consultation or abandon the notion totally and instead look to collaborate with all stakeholders in education. Too often, proposals and announcements are devoid of the input of that broader stakeholder group. When there is actually evidence that there are principals and teachers with workable solutions that could be put to the benefit of our children and the entire education system. In response to CSEC, I want to share with you some of what persons on the ground have said to me. In response to CSEC, principals have said, we would have wanted greater and earlier advocacy on behalf of our students, read the concessions around CSEC exams. They have said, if our strategic thinking and wisdom had been taken into account, we would have been in a different place. They have also said, the Honourable Minister would have known or should have known that grade 11 students would have had major and persistent disruptions to their formal face-to-face education from very early, and therefore would have found it difficult to complete the CSEC exam, the CSEC syllabus. In response to the reopening of schools, they have said the minister's announcements seem to think that one size fits all. This yo-yo effect have left my teachers frustrated and exhausted, some totally demoralized. So we have had to be dealing with psychosocial support for both our teachers as well as our students. They have said that the school environment in many instances would have been much safer for the students than leaving them out there. They have said that most of them are not reaching more than 50% of their students, and that to understand the real engagement loss, we have to go beyond the numbers of those who have logged in and look at the poor quality of the engagement. They have also said, we need to look at classes, why there are classes with extremely good attendance at the same school, while you have classes with extremely low attendance. What's happening there, and how do we identify what's working and get that to be the standard? Principals have also said that what's missing is a strategic plan that covers all students, not just exam grades. They have also said that the 5-year plan announced by the government to improve bandwidth and build out digital infrastructure is not acceptable for the education sector, because that would ignore the crisis in which we find ourselves. They are asking for immediate improvement to the digital infrastructure at schools, which would help some teachers themselves who are unable to teach from home. From discussions with some private school operators, they are confounded, and quite frankly, so am I, that given the crisis in education, the Ministry of Education, Youth and Information did not naturally include them in access to online platforms and in capacity building sessions to enable all teachers to quickly embrace this new technology and adopt teaching methods which are more suited for these challenging times. As we look to see the kind of incentives that we give to businesses and the support needed by our schools, I recommend that this sector be given special attention, recognizing their traditional contribution to educating our children. Madam Speaker, listening attentively to the heart and mind of our principals and teachers would have made a huge difference in the fundamental decisions that are being made about education. An interesting report was actually one done by the World Bank called Acting Now to Protect the Human Capital of Our Children. And it looked at the impact of the COVID-19 responses on the education sector in Latin America. And here I quote, "Commendable efforts have been made on many fronts by countries, but we may witness an educational tragedy as never seen before in the coming years if countries do not act faster and more comprehensively." They said that many students, particularly from lower income groups and those who were learning very little before the crisis, are now at increased risks. That sets out very clearly exactly where we are. And while we may not be like some countries in the region, Madam Speaker, like Chile or Colombia, if the government does not take heed and be more strategic in its thinking and its implementation of policies and programs, we will suffer great loss. And Madam Speaker, I am not being alarmist. As policy makers and practitioners, we really have to take a responsible attitude to understanding how the winds are blowing, begin to change the course we have charted in order to navigate the best way forward in our education system that seems to be approaching an iceberg. We will need all hands on deck to build back stronger and better. The same World Bank report suggests that we should look at good practices and that are being adapted already in the school and scale those to see if we can accelerate learning and improve equity. They have also said that COVID-19 is an opportunity to transform the education system and develop a new vision where learning happens for everyone, everywhere. Along with the World Bank statements quoted a while ago, Madam Speaker, one of our well-known educators has recommended that in the interregnum, we should be pragmatic. And another said, we should see teaching and learning as a matter of urgency. Whether we are being pragmatic or progressive or both, we must provide an inclusive, equitable, quality education and promote lifelong learning. So let me look at early childhood education. We all agree that that is where we start and that is the foundation, where we learn to know, to do, to be, and to live together with others, and that this sets the phase for everything else that takes place. The data suggests that children who fall behind in these early years often never catch up with their peers, leaving them more likely to drop out of school later on and fail to reach their full potential. So what that means, Madam Speaker, is that where we see now that schools, institutions in this sector are struggling, some have closed their doors, others are under great stress to provide a few days school. Parents are having difficulty balancing caring for their children and working at the same time. And this is particularly problematic where these parents are either frontline workers or supporting frontline workers. So what we have not talked about, Madam Speaker, are the hundreds of early childhood practitioners who have not been paid for months or only given a small stipend, sometimes below the minimum wage, but they continue to give service to the sector. I believe they deserve better as well. Yes? And our children at this level deserve better. We already know, all the data is showing, that remote learning, online platforms, are not natural substitutes for face-to-face. But what is true is that the new world in which we are going to have to contend with some hybrid, yes, some blended mode between our online and our face-to-face. And so what we have to do is to make sure that we deal with issues of access, family structures, participation, and engagement of those who are most vulnerable. The minister in her presentation spoke about 120,000 children who she said were either missing out on education or who cannot be found. I'm not sure how many of them in the early childhood sector would fall in the 120,000, and whether or not the children in early childhood education have been accounted for and were counted. Madam Speaker, not much really has been said over the 18 months about early childhood education. And many of you would have heard me come to the House time and time again to ask what's happening in early childhood education and to express my concern about what was happening there. Practitioners in the sector have always tried to ensure that the educational and development experiences of their children are holistic, including providing nutrition. Given what's happening, we know that many of them are struggling with nutrition. One principal of an infant department indicated to me that when she started in September 2020 and measured her students, she found many of them more underweight than she had seen in previous years. We have to find a way to meet the nutritional needs of the students at this level. Madam Speaker, we also know that there are many of us inside this House, certainly, would have been in contact with parents, families who are not on path, but who we know, given their circumstances, need path to actually survive. We have to find a way to make sure that we don't ignore them and that we also include them. Madam Speaker, special education. When I talk to educators there, I hear a refrain ringing in my ears. Our children are left behind. Our children are left behind. Our children are left behind. They are at their wits' end. The teachers themselves feel as if they too are left behind. So we're not just talking about a learning loss. We're talking about teachers lost, learning lost. We're talking about wiping out valuable contributors and contributions from valuable Jamaican children. I'm not even going to, in the interest of time, I won't tell you some of the statements I've heard coming from them. Primary and secondary. Student performance at the primary level has been making incremental but important steps. From 2012 to 2016, we had a very strict IMF regime, and we were operating in tight fiscal space. But the approach was to ensure that the policies were put in place could be financed, implemented, monitored, and evaluated for their success. Madam Speaker, if the government were serious about where we are in education and the priority to be placed on education, let's take, for example, the same Mobe development. We found ourselves as government in a position where instead of taking a loan, we could actually use our own. We could actually use money that we had as a government. Now, can you imagine the difference it would have made if, for example, we would have taken a loan to do that infrastructure project and use the money that we had in our coffers to inject and improve the education system, knowing exactly how unequal it has been, knowing how many of our children have been left behind for years. And when I speak here, Madam Speaker, I am not laying
Madam Speaker, I now ask that the standing orders be suspended to enable the member to continue her speech to its conclusion, notwithstanding the time limit on speeches.
Members, the question before the House is that the member be allowed to complete her presentation. Those in favor? Aye. Those against? The ayes have it.
Thank you, Madam Speaker. Thank you, colleagues. The point I was making, Madam Speaker, is that the situation of education and where we are has been the accumulation of how we have approached education for several years. I'm not laying it at any one government's foot. What I am saying, however, is that the pandemic revealed, even if we were trying to ignore it, even if we didn't know it, it slapped us in the face. The divide, the apartheid in education between our rural schools, between our inner city schools, between those schools where we just don't have the kind of support. Yes? Where children who are not doing as well in primary school get placed, for example. What we need in education is to press the reset button that gives our children, the majority of them, 80% of our children, a chance to become that educated Jamaican. And it will not happen if we just coast along. I am still skipping. Madam Speaker, the data that has been collected, I don't think we share enough of the data. In the minister's presentation, there was a lot of data shared, and that's good. When we share data, however, we have to understand the importance of data. Data needs to be interrogated. It needs to be presented in a manner that questions can be asked, that you can relate it to what you are doing on the ground and what you're seeing. Ask questions, and so that you can understand it. As a country, we do produce data. We do not share data sufficiently. We do not allow individuals who are operating in a sector to have that data to be able to do a proper analysis and to be able to make decisions that are going to improve the system that we have. And that is also what we are finding in education. Madam Speaker, I know that up to 2019, about 25% of our students failed to move on from grade 9 to 10, grade 10 and 11. Between grade 9 and grade 11, we normally lose about a quarter, 20% of our students. Are there any special policies being implemented to retain these students? Are they also among the 120,000? Yes? The National Education Institute in 2019 indicates that we have seen some improvement over the 2015 baseline performance, and that's excellent. We see with that what can be achieved when schools have standard indicators and when they are encouraged to build a system to the benefit of their children. But it also cited some areas that needed improvement, like school leadership and those that we're really going to have to look at as well. Madam Speaker, one of the ways that school leadership can be supported is by giving principals the wherewithal and the flexibility to be more autonomous, to take sound leadership decisions, to work collaboratively. After all, some of us do learn by doing. Yes, and that is one way of actually helping them to improve leadership. Instead, Madam Speaker, we tend to be seeing a kind of top-down spoon-feeding of some of our leaders that has left them too dependent on the central ministry. I think we have to increase the opportunities for them to share with one another so that they can actually also learn from one another. Madam Speaker, grades 1, the same thing with grades 1 to 3 is the same thing with grades 7 to 9, because we have been focusing on exam grades. And what we have seen there is a disengagement from learning, a feeling of alienation, inappropriate transitioning from one phase of education to another, a return to child labor, where children as young as 10 and 11 are out trying to earn for the family, the impact of food shortages, the lack of parental supervision. All of these might be more pronounced in one sector or the other, but all of them should give us great cause for concern and drive us to take action. Madam Speaker, let me look at the vocational and development, skills development, talking just really on hard trust NTA. Madam Speaker, the opposition is deeply distressed at the state of affairs of the most recent transition of the Hard Trust NTA, now the Hard Trust NTSA. This agency, initially conceived in 1982 by the late Prime Minister, the Most Honorable Edward Seago, was repurposed in 1991 by former Prime Minister, the Most Honorable P.J. Patterson, as a national training agency to coordinate standards-based vocational training for all working-age Jamaicans, youth and adults, with the assessment and certification functions. I am unclear, and I understand the general public is, as well as some of the very employees of the agency, as to this new HEART NTSA. I take the opportunity to urge the Honourable Minister to clarify what is its role, what it is about, what its functions, the governance and financial situation, and address the angst being experienced by employees, service providers, and many others. In this time when we need all our national effort to be placed on education, training, and certification in order to respond to the challenges facing us, we cannot afford for such a flagship institution to have its efforts diverted or distracted by rumors, ineffective governance, and the lack of strategic thinking and positioning. Madam Speaker, the government has announced this merger between the Jamaica Foundation for Lifelong Learning, the Apprenticeship Board, the National Youth Service, 3 differently purposed agencies into HEART NTSA as the National Training Service Agency. What have we seen with that? According to the recent Auditor General's report, training enrollment and certification levels are down by 50%. HEART's assessment and certification arm, NCTVET, has been left underfunded at the Ministry of Education, while the lucrative HEART Trust Fund, which now enjoys $11 billion annual intake from employers, has been transferred, yes, Madam Speaker, to the Office of the Prime Minister. Yes, where 70% of gross expenditure is allocated to administration and 30% only to training operations. It's not sustainable, it doesn't sound right, it doesn't look good. The opposition is particularly worried because when these issues are added to the reputational damage from allegations around the award of supplier contracts, there is a real possibility of negatively affecting the social and economic development of our country. Jamaica would then run the risk of reducing the employability, personal development, and opportunities for further education and development of potentially thousands of youngsters annually. Madam Speaker, let me turn to tertiary education. And in relation to this, I want to say that we haven't seen a clear vision from the ministry. It is our considered assessment and evaluation, Madam Speaker, that the minister's presentation was devoid of an overarching and compelling vision for the kind of society we wish to create, and therefore the kind of education system we must design and implement. Let me say this. One of the characteristics of countries with high levels of GDP, Madam Speaker, is that they also boast of high levels of participation rate in tertiary education. But more importantly, they also have low levels of crime and high rates of innovation. And I have a table there, but I'll just use one example. And I will look at Denmark or Singapore. And if you look there, you will see the GDP, you will see the GDP per capita. You will also see that in those areas, Madam Speaker, tertiary participation is in the 80%. And their murder rate is extremely low. So what we're seeing is that there is a relationship between tertiary participation rates on one hand, the per capita income, murder rates, and innovation on the other. In very simple terms, more people who are tertiary trained in a country will lead to that country producing, in terms of goods and services, more. Each person earns more. Instructively and critically for us in Jamaica, Madam Speaker, it also means that there would be lower levels of crime, especially murders, and the higher levels of problem solving and improved quality of life through innovation and new technologies. So our message, Madam Speaker, is this. If we want to create a Jamaica that is not only safe, but one which is truly prosperous, and where our people want to live and to do business, we must create a tertiary education system which is attractive, flexible, responsive, and futuristic in its program offerings. The institutions therefore need to be well funded and a mechanism in place to broaden access to more Jamaicans, especially those in lower socio-economic groups. And in that regard, Madam Speaker, I looked at some possibilities for funding, but I'll only mention one. And that is, we have $50 billion or so in dormant accounts. If we were to provide emergency funding to UA, Youth, and UTEC, for example, and add a percentage to the budget to fund that, we could, in fact, allocate some funds to the Mona campus, to UTEC, yes, and then to other institutions for their capital development. And the details, Madam Speaker, could be worked out by a special task force. This is not the first time that this is being mooted, because a lot of work has been done on it. A former member of these very houses placed on record this proposal. We are expecting as well for the medium term, Madam Speaker, that the task force chaired by Professor Patterson, in completing its work, would look at the relationship between community colleges, teachers' colleges, and the universities, and how they can be recalibrated for greater synergy and for strategic cooperation to reduce costs on one hand, improve revenues, and innovative inputs on the other. Madam Speaker, we are also proposing the establishment of a Child Opportunity Trust Fund. I will not go into the details of that. As I said before, these are not new ideas that I'm coming up with. These are ideas that certainly Kenny Thompson, Bazawait have placed on the table and have done significant research and work around that. Madam Speaker, these measures would go a far way in helping to create a clean, peaceful, safe, innovative, productive, and prosperous Jamaica. Madam Speaker, our teacher training institutions could really be considered the Cinderella of the system. They need to be supported to become responsive and strategic in their program offerings. And this goes across the entire continuum, the entire spectrum, the entire sector. It should be clear by now, Madam Speaker, that I have premised my presentation on pillars of equity and social justice. I also want to bring to attention that cross-cutting theme of gender. In Jamaica, we know we have a gender policy that has benefited from research and across administration, and clearly advocates for gender mainstreaming, gender analysis, and gender-aware monitoring and evaluation. What we clearly need now is an integration of that gender policy into the education policy, the education sector, so that education guidelines, procedures, curriculum, teacher training, etc., would all become gender-aware. Madam Speaker, the ministry needs to urgently support our teachers in unpacking our cultural norms and how they may even be influencing the education of our girls and boys, because we have an education system, certainly between the early childhood education sector and primary, where the vast majority of our teachers are females, yes? And where we see our boys failing. So we have to begin to look at what is happening there. And the teacher training institutions, I submit, have a role to play. We also need a policy environment that would talk to that kind of synergy that I spoke of earlier between all the institutions that provide, for example, teacher training programs. Madam Speaker, I want to just look at some specific recommendations that we want to make. And I'm doing this against the background of the same report that I keep quoting that says that we need to act with urgency to address the many challenges that the education system is facing to maintain continuity, engagement, and quality while seizing opportunities to build back stronger in the long run. We need a Ministry of Education with a vision and a mission that is clear, futuristic, audacious, and creates a dream that students, teachers, parents, and everyone, even the most disaffected members of our community, can relate to and support. The report from the 2004 task force made 3 recommendations that I just want to mention. One has to do with the values and attitude, character, education that the minister has spoken about. So I'm not going to delve into that. I'm hoping that it is building on the research and what has come before. But the other 2, one includes focusing on improving literacy and grade level remediation. Let's get our students reading at grade level, from primary schools through to high schools, with a well-sustained, well-resourced program that could significantly improve literacy levels, thus laying a strong foundation for a transformed education system. Can you imagine the difference it would make in other subject areas where our students actually are able to read the text, understand the notes, and complete their homework? The third recommendation coming from the 2004 task force is a simple one: to use visual and performing arts, not just as subjects, but to use it also to design and deliver the curriculum. So I put those there. In addition to that, Madam Speaker, I want to end by just making a couple of other recommendations. And one is to strengthen the early childhood to secondary sectors. I want to make a call for the ministry to put in place a plan that brings our children back to preschool, face-to-face, far more than we have seen. Yes, for the early childhood education. I want to make a call for a collaborative plan, for that plan to take into consideration our teachers and what they have been doing there. Yes, that would also look at a whole of country effort. Yes, recognizing our private schools as partners in education. And the goal, Madam Speaker, is probably a 2-year plan that gets our children to learn to read so that they can then read to learn. So that is the plan. I want to ask also for support for our families. We know what's happening now, and we are going to need our families as part of that set of collaborators in education. And then the next one, Madam Speaker, is really fully integrating information and communication technology into our classrooms. As I said before, it's here to stay. We have to have a bold and courageous plan that recognizes technology, not just to replace teachers, because it really can't, but instead to enhance the work that they do and provide a platform that can support individualized learning and playful learning through games, etc. Madam Speaker, we also need to continue to give support to our principals and teachers and the efforts that they're making to develop that coalition and the skills in advocacy for the best for their schools and the students they serve. If we begin to become the change we wish to see, nothing will be impossible. Madam Speaker, I turn briefly now, as I end, to Southwest St. Andrew. Like most of Jamaica, COVID-19 hit us like the rest, and our education system and sector suffered like the others. So I will not even mention what I have there in terms of the education system. What I will say, however, Madam Speaker, is that what COVID has done for us is to remind us that infrastructure is not just about roads and those other things, but that for education, it includes a digital backbone, it includes our access points. So the 2 access points which have been announced by the government, yesterday we heard 3, but when I was called, I was told it was 2, so I'm talking on the basis of that. The 3rd one is certainly appreciated. But, Madam Speaker, I found it amazing that when I suggested to CDF that I wanted to use some of the money that was allocated to the constituency, either through education or infrastructure, to set up a 3rd community access point, because I recognized that the constituency of Southwest St. Andrew really had a challenge in terms of our digital backbone. I was told that that's not possible. Something has to be done with that. And that also, yes, and that also leads me to another point about the CDF. Apart from the fact that I think it needs more for us to do more for the people we serve, I believe that there also needs to be greater flexibility. And I'm not suggesting that we remove the strictures that are there in terms of accountability, but flexibility so that constituencies can respond to the predominant need in their constituencies, because, again, we are not all the same. Madam Speaker, crime. As I was coming here today, well, earlier today I got a call asking me to come down to the constituency because we had another fatal shooting today. So I just want to express my sympathies, to the number of individuals that we have lost this year to the gun and criminal activities of one sort or another. Madam Speaker, I've come to this House and I've spoken so much about crime in the constituency. When I started talking about it, persons thought that I was not giving credit where credit was due, and I was talking as if it was this horrible place. It's a lovely place with lovely individuals, Jamaicans who are just looking out for an opportunity to make sure that their children are better than they are and to do the best they can for their children. But unfortunately, we have found in the constituency a number of gangs that create mayhem and havoc in the constituency. We are thankful that Greenwich Town has a Zozo. It has made a difference, although that killing was actually in Greenwich Town. It has made a difference, and we have had murders there, but I believe that those murders have been significantly reduced because of the boots on the ground and the other programs that are there engaging the community. So we have seen the impact there. And I want at this point to pause and say a special thanks to the members of the joint forces on the ground, as well as members out of Hunts Bay, who have been responsive. Madam Speaker, sometimes they get several calls per day, several days per week, and they have been there. But there are other areas that surround Greenwich Town that are tense and where we have problems. So we still need to see what we do with those. And I'm asking for targeted social intervention programs. Yes? Because the disruption in schools and the lack of supervision has meant that many of our students are now disengaged, on the road, looking income, and it's a perfect opportunity for our boys to be lured into negative activities and for our girls to drop out of school because they have become pregnant. Madam Speaker, the matter of infrastructure. I'm happy to announce that through the partnership of TPDCO and the KSAMC, we're able to open some new shops as part of the upgrading of the facilities of DC Tavares Market. Many of you passing on Spanish Town Road under the new road there would see these lovely buildings that are there. And I'm encouraging members of the public to stop by and support our vendors. I am also pleased to announce that through the CDF, again with TPDCO, we have been able to retrofit and to build the Tavares Gardens Homework and Resource Center, and that it will be open this summer. I am especially proud that this center will be powered by solar energy. And many of you would know the issue of placing those centers in the middle of our communities when it comes to electricity. But, Madam Speaker, what I'm even more proud of, really, is that I have an enthusiastic group of youngsters, some in high school, some in university, and some who are just finishing university, who have volunteered as tutors to help with homework and improving the performance in several subject areas. I am extremely proud of that. I also, Madam Speaker, at this point, want to thank the Most Honourable Portia Simpson-Miller for her vision for Southwest St. Andrew and her plans for improving the housing stock in the constituency. At this point, we are almost at the end of another phase of housing being constructed in Majestic Gardens. And the infrastructure work for another project in White Wing housing scheme is underway. I also want to use the opportunity to thank the current administration for continuing these projects and not jettisoning them, and for the continued commitment towards making these housing solutions affordable. Residents, NHT contributors in and around the community have been eagerly waiting for these projects and are ready and eager to purchase. Madam Speaker, I continue to lobby for improvements to our roads. Southwest St. Andrew, we have a number of major thoroughfares. Spanish Town Road is one that comes to mind. It has been in the news very often. It's in a deplorable state. Both residents, motorists, pedestrians, believe you me, repair is long overdue. If you have to drive there, you have to worry about the cost to repair your front end. If you have to cross the road, you have to worry about the risk to life. I have spoken to the Minister with responsibility and the NWA, and they have given me assurances that it will be repaired in short order as soon as we complete major infrastructure work that is going on, laying water pipes. Madam Speaker, East Avenue. When Portia Simpson-Miller Square was changed with the building of the roadway there, we had several diversions of traffic within the community. East Avenue became a one-way from Marcus Garvey Drive up to Spanish Town Road. Many people who don't live in the community would not understand the disruption to the community. What it meant is that individuals who lived in the community could no longer easily access Marcus Garvey Drive. They had to, some of them, go all the way up to Spanish Town Road and probably go back through 3 miles to come back on Marcus Garvey Drive. They have been patient, they have said nothing, and they have been cooperative. I have done all the lobbying that I can. I have written letters. I have made calls. The councillor has done the same. And I have promised the residents in Greenwich Town that when they are ready with their placards, I will be there too. I have. Because at this point, notwithstanding commitments to have East Avenue revert to two-way, including while I was at a meeting in the community and called and got an assurance which I transmitted to the residents, we have seen no sign of it changing. And I believe that they have suffered enough. Madam Speaker, water. We know that water is supposed to be coming with the laying of those major pipes. But even in ordinary times, it's difficult to ask people to wait for water. And especially now under the pandemic where washing of hands and so on is part of the protocol. NWC has been responsive, but we need more. We need more because it's a real problem getting water in our communities. I also continue. Madam Speaker, we were able as members of parliament to give some relief to our constituents in terms of food packages. At this point, I just want to say thanks to a number of civil society organizations, NGOs, and good neighbors who have also assisted and have helped to make that relief. The assistance from the government in doing this was also very good. Against the background of that, I also welcome the social pension for seniors, and I think it's an excellent idea. But in trying to assist some of my seniors, I find that we have to revisit what we do and what we ask them for. The birth certificates, the NIS, the Tertiary numbers is a challenge for many of them. The requirement, even when you're asking for emails, is also a problem. Do you know that in following up on even the own your own device, when the minister came and spoke about how many of them had not redeemed their vouchers, I found out, Madam Speaker, that many people just made up an email and put it in because it was a requirement. They don't have one. So what that also means now is that they didn't get the email, they don't get the voucher to redeem. And sometimes we have to bear these things in mind. Madam Speaker, I close. As I close, I just once again want to express my thanks and gratitude to the people of Southwest St. Andrew who have welcomed me in their community and into their homes. They have graciously asked me to represent them in this honorable house. They expect that I will faithfully represent their issues and find resolution. I am honored to be their servant's leader. I am honored to take the baton from one of the greatest leaders in this country has ever seen, the most honorable Portia Simpson Miller. Each time I stand to speak or as I participate in discussions, I remember that I am indeed their representative, and I bring them with me. I therefore give them thanks and renew my commitment to boldly and courageously defend and advocate on their behalf. Thank you.
Madam Speaker, excellent presentations. The Minister of Health, the Honorable Christopher Tufton, made an excellent presentation and brought us some goodies. I just want to say to members to remember to collect your gifts provided by the Minister of Health and Wellness from the government conference room when you depart. And I also want to thank and commend Member of Parliament, Dr. Angela Brown-Burke, Member of Parliament for Southwest St. Andrew for a presentation. Madam Speaker, at this time, I now ask that the debate be suspended.
The question before the House to the members is at this time, the sectoral debate is now suspended, and we return to the agenda of the House, today's business. Those in favor? Those against? The ayes have it.
Madam Speaker, I ask for recommittal of items from bills brought from the Senate through to
House Leader, I think it would be after the call of the roll.
Statements.
Yes.
I ask for the recommittal of statements by ministers through to presentation of bills without leave of the House first obtained. And this will give the opportunity to the Honorable Fayval Williams, MP, Minister of Education, Youth and Information, to make a statement.
I'm sorry, Minister Fayval Williams, please. The question. I apologize. I was speaking. Where are we? Where are we now? Those in favor? Aye. Those against? The ayes have it.
Thank you, Madam Speaker. Madam Speaker, the government of Jamaica has provided $720 million as an incentive for non-path students to acquire devices. The program known
Just a minute. Can somebody use the other mic? I'm hardly here. She put both mics, yes, for her. Yes, so you can hear.
All right. Thank you, Madam Speaker. The government of Jamaica has provided $720 million as an incentive for non-path students to acquire devices. The program, known as the Own Your Own Device, OYOD Incentive Program, is aimed at benefiting 36,000 non-path students with a $20,000 voucher towards the purchase of a tablet or laptop. Madam Speaker, the Ministry of Education, Youth and Information would like to thank all parents and guardians who applied for the Own Your Own Device incentive thus far. As of Monday, May 17, we have received 34,058 applications on our electronic system. This amount represents 95% of the target and shows the need throughout our country to provide devices for our students. We have issued approximately 24,000 vouchers to date, and as of Monday, May 17, approximately 13,337 parents or guardians have redeemed their vouchers at the various approved vendors valued at $226.7 million and representing approximately 32% of the allocated funding. Madam Speaker, some months ago, the ministry made the decision to increase the annual income threshold for the OYOD incentive program from $500,000 annually to $1.5 million, which has broadened the chances of a parent or guardian being deemed eligible for this incentive. In terms of application states, based on the final verification by way of the scoring rubric, Tax Administration of Jamaica, TAJ income verification, and National Student Registration System, 24,437 applicants have been approved and issued vouchers. 5,287 applications did not meet the criteria. We are processing 1,614 applicants right now, and they're being issued with vouchers. 1,836 applications are under review due to TAJ income discrepancies, and 34 applicants have been placed for consideration based on the scoring rubric. The data has shown that in terms of gender distribution, 16,820 males or fathers or guardians have opted for the incentive, while 17,238 females or mothers or guardians have applied. The parish distribution, and there should be a slide, oh, it's right there. It's on the slide, shows that the majority of the applications were made in St. Catherine, St. Anne, Kingston, and St. Andrew. The data is also being aggregated to show the number of students who have been deemed eligible for the program by school. And the slide being shown now indicates that the top schools in which students have benefited are Mandeville Primary and Junior High, Marley-Mount Primary and Infant, Ocherias Primary, Southborough Primary, St. John's Primary, Mona Heights Primary, Ocherias High, George Headley Primary, St. Jude's Primary, and Barracks Road Primary. In terms of voucher redemption, as stated previously, we've issued approximately 24,000 vouchers to date, and as of Monday, May 17, approximately 13,337 parents or guardians have redeemed their vouchers at the various approved vendors. The demand for devices is very evident, and the data shows that 13,173 applicants have used the incentive to purchase a tablet, while 164 applicants used the funds towards purchase of a laptop. We've also broken the data down by the grade level, and the data indicate that the majority of voucher redemptions have been done for students in grade 4. And then you can see that followed by grade 3, then grade 5, grade 6, grade 2, grade 7, grade 8, and grade 1. For ease of access, I'd like to take this opportunity to remind the public of the 11 approved vendors for the OYOD program. The approved vendors are Royal Computers and Accessories, Full Service Consultants Limited, Smart Mobile Solutions, Jamaica Limited, Solution Integrators Corporate Limited, Resolve It, Tread Laboratories Limited, Productive Business Solutions Limited, Quartz Jamaica Limited, Jewelry Collection, Land Integrators Limited, and Flow Jamaica. These vendors have in turn partnered with sub-vendors, allowing for over 100 outlets island-wide for the redemption of vouchers. These locations are also listed on the website of eLearning Jamaica at www.elearningja.gov.jm. The following are the steps for redeeming a voucher. In the event there is need for information, parent or guardians redeeming a voucher must present their valid Government of Jamaica picture ID, their TRN, and the voucher number, whether in printed or electronic format. If the redemption of a voucher is being done by a bearer, that individual must present a valid GOJ picture ID of the bearer, a certified by a Justice of the Peace copy of the applicant's valid GOJ picture ID, TRN, and letter of authorization with the applicant's signature matching that on the picture ID. We're grateful for the continued support with the Own Your Own Device incentive program, especially from our hardworking members of Parliament. And you would have noticed that last week, in order to assist you with the queries and concerns that you have, we sent out an application status report to each MP. We were not able to go down to the constituency level. The report is separated by parish, and so within the parish, you should be able to identify your schools, and that would give you an idea of the number of vouchers that have been received or redeemed in your constituency. Kindly note that if the report indicates that an e-voucher has been sent to an applicant, and this applicant indicates that they have not received the e-voucher via email or SMS, you may send the parents' and students' name associated with that application to the following oyod.support@moey.gov.jm, and we will resend the e-voucher to the applicant once the verification is done. Additionally, Madam Speaker, shortly, as in by next week, we will launch as well on our website an app that all you need to do is to put in the name of the student and the student registration number, and it will also tell you if the student has already benefited from receiving an e-voucher, and even whether or not that voucher was redeemed. Madam Speaker, after careful consideration, we've taken the decision to pause and assess the OYOD program just to ensure that we look at all the data that we have. We will reopen it in short order in about a week or so. This is just allowing us to ensure that we look at those that were deemed denied, and we ensure that they were rightly so denied. So, Madam Speaker, the Ministry continues to work relentlessly to have a device in the hands of every Jamaican student, and we will not stop until this mission is completed. And, Madam Speaker, I just want to say that the Ministry did create 32,068 learning management system accounts for our private schools as per the data submitted to us by the private schools, and that the ECC is not aware of any practitioner that has not been paid for months. Thank you.
Madam Speaker, as you would imagine, having made my presentation, I do not intend to get into a discussion with the minister about any matter that I raised there. I'm going to take the liberty that every single speaker has had when they have made their presentation to allow that discussion to be distilled elsewhere and not here in the Parliament. So that's the first thing. As it relates to the rest of the statement that the minister came prepared to make, which is what I will address. Minister, I know that 32% of the e-vouchers being redeemed is really concerning, because we want to make sure that more of them take it up. I did receive the file. I am actually getting it disaggregated, and I suspect others are, so that we can concentrate on the individuals in the constituency. I think it is important to do that so we can actually use it well. Madam Minister, it would be interesting if we could get, for example, the data, comprehensive tally of the devices that have been distributed. Whether, for example, for those who are on PATH, what percentage of the PATH students, not from exam grades now, but of our PATH students have received devices. For the on-your-own devices, in terms of what is the ratio of the rest of the population, the student population, and those who would have gotten other devices from on-your-own devices, from the PATH, and I know we also have private donors who are making contributions. In other words, I believe that certainly schools are asking, because they don't know, could have asked me. MPs have been asking, because they're not aware, as to what is the gap in a constituency, what is the gap in a school in terms of the devices, just to have an idea as to where that is. Madam Speaker, there seems to be, Madam Minister, there seems to be an issue with some of the vendors, and so I want to use the opportunity while I'm speaking with you to remind parents of their rights as customers to shop around, to make sure they get good customer service and good prices, right? Because sometimes when you get that, there is a feeling that, boy, I just have to take what I get. Yeah, and I think it's important for persons to know that they do have options. So that's one. The other thing is you have decided to pause and assess the Own Your Own Device program. I'm not very certain what that means, whether it means that no additional vouchers will be distributed, but that individuals who have received their vouchers can continue to redeem it, because it wasn't clear. So I think that you would need to just clarify that so persons are very clear on what is expected and what pertains to them. I am suspecting, because you have said that the e-vouchers can be resubmitted either through email or SMS, that for those who do not have a valid email, what submitted an email, for example, and therefore they have not gotten it, that they too could reach out and it could probably be sent to them by SMS. I just wanted to confirm that that is so.
Thank you for those questions, member. Let me take the last one. Yes, the voucher redemption process will continue. Just because we have paused, that's not going to impact the voucher redemption process. And in terms of the issue that you mentioned with the vendors and their kind of the customer service or lack of customer service that they may have with regards to persons going in to redeem, I would love for those persons to contact us with the names of the vendors that they're experiencing the bad customer service with, because it's for us it should be a privilege for vendors to be on this list to be able to serve, you know, the education sector. So we'd love to hear that. What's your name, Mister? And your question about the notification, we can do it by SMS. Was that the question? We can definitely send it by SMS as well. And we. Right, so the kind of overall comprehensive list. Okay, that number of, you know, those figures I wouldn't have right now, but we know what they are. Yeah. Okay. And I think I've answered the questions, the issues you've raised. Was there any that I missed? That's it. All right. Thank you.
Minister, just two questions on the tablet program. One, in a case where a parent believes they have been denied, but unfairly, meaning that you have done your assessment and you have deemed that they have not met the qualifications for the tablet, is there a process that that parent can go through, either come into the ministry, call in a number, etc., to say, listen, I think your process was incorrect, and I believe I qualified? That's one. And secondly, for us as members of parliament who were given a particular allocation, in a case where, for example, out of the 250 forms, let's say 40 of my applications were deemed ineligible, so they're denied, do I get an additional 40 to make up my 250? Because as you appreciate, there is demand for the tablets, and there are other persons who are asking for the tablets. And what would be the process to achieve that?
Sure, member, for the persons who did not meet the criteria and feel that they should have, they can query. When we looked at the applications that did not meet the criteria, a majority of the reason had to do with two things. They're on path, or their income is above the threshold. So, you know, we would welcome any query, though, so we can walk through with any particular applicant exactly what was the reason for them not meeting the criteria. And then with regards to the allocation to MPs, yes, you can substitute for other names for those persons who would have not met the criteria.
There are some issues, there have been a lot of issues with TRNs where persons incorrectly miss a digit or put a different digit, and the system bounces them, because when you put in the number, it doesn't match with the name. In those cases, again, is there a hotline or a specific, apart from the email? Because again, the majority of these persons don't have access to that. But is there a help desk that they can call and say, listen, this is my correct TRN, and I think this is the issue why I was bounced?
If I could, Madam Speaker, there was in fact one question that I had asked that was not answered. There was a question that was asked which had to do with the ratio of PATH students overall, not just in exam grades, who have not benefited from a tablet. And otherwise, it would be important to know how many students we have in the system who are on PATH but did not or do not have a device.
All right, I'll include that, member, when I look at the overall figures. All right. And then with regards to the helplines, there are two, 1888 Educate or 1888 Educate. In terms of what the actual number is, it's 888-338-2283 or 1-888 school time SCHTIME, or the actual number 888-724-8463.
Just a minor thing. Just ask your ministry to just send us the information via email so that we all have it and we can share it with the persons.
Announcements.
Laid on the table of the House today is a copy of the annual report of the Jamaica Promotion Corporation, JAMPRO, for the year 2018-2019.
It's brought from the Senate. Petitions, papers, reports from committees, notices of motions given orally, questions and answers to questions, motions that may be made at the commencement of public business requiring notice, motions relating to sittings of the House, motions for leave to introduce bills, presentation of bills without leave of the House first obtained, public business.
Madam Speaker, there are two matters that I would have indicated we would have taken today, Madam Speaker. I will start with the Conch export levy, which is very simple, Madam Speaker, and then my intention is to start with the Conch export levy and treat with that first, and then to open the debate on the Agro-Invest Corporation bill. Madam Speaker, the 1st of April, we would have reopened our fishery in relation to Queen Conch after closing it for 2 years due to heavy poaching and illegal, unreported and unregulated fisheries. We have reopened, Madam Speaker. We have put in place strict no harvesting zones, and we have an allowable catch of 300 metric tons. Of note, Madam Speaker, 30 metric tons was set aside exclusively for the local trade, while the remaining 270 metric tons will be allocated, has been allocated to industrial Queen Conch fisheries for exports. A critical part of the industry, Madam Speaker, is the Conch Export Levy Act, by virtue of which there is a levy that is charged by the government on the exportation of conch. Just to indicate, Madam Speaker, that levy actually goes into our fund and allows us to set up our conservation areas. We use the proceeds from that levy to treat with our fish sanctuaries. So not only are we happy that we are able to sustain a conch fisheries for this year, it is also very important that we go through this process, which is to pass the resolution so that we can have the conch levy be in charge. So, Madam Speaker, the Minister is empowered by virtue of Section 31C2 of the Conch Export Levy Act that the order can be made, and the order is cited as the Conch Export Levy Rate of Levy Order 2021. The levy for this conch season, Madam Speaker, is 50 US cents per pound of conch which is exported. Just to indicate, Madam Speaker, this is a discounted levy, and we have decided to go that route because, as you can imagine, our industrial fishers who have been without the conch industry for the last 2 years would have suffered significant displacement. And also, with all that is happening with COVID-19, we thought it very important that as we get back into the conch industry, and considering that we have a limited quota, that we maintain a discounted levy rate at 50 United States cents per pound of conch. that is exported from Jamaica during the 2020 season. So, Madam Speaker, with that, I open the debate in relation to the Conch Export Levy Rate of Levy Order 2021 resolution.
Are there any members who'd like to contribute?
Madam Speaker, I think this is very straightforward, a very straightforward resolution, and I'm sure the commercial conch fishers are very happy to hear that they're going to receive a discount this year. But I hope they don't get used to getting a discount every year, Minister, because you know we can't operate without the levy. I think it's very straightforward, Madam Speaker, and certainly I have no objection to it.
Thank you, Member. Minister?
Yes, Madam Speaker. Thank you, Member Cousin. So, Madam Speaker, to conclude, this resolution may be cited as the Conch Export Levy Rate of Levy Order 2021 resolution, and I ask that the Conch Export Levy Rate of Levy Order 2021 be affirmed, Madam Speaker.
Members, before the House is the motion, and the question is that the motion be approved. Those in favor? Aye. Those against? The ayes have it.
Thank you, Madam Speaker. Madam Speaker, I will now quickly treat with the Agro-Invest Corporation Amendment Bill 2021. Madam Speaker, the bill before this House is the Agro-Invest Corporation Amendment Bill 2021. Cabinet, by its decision number 818, dated March 6, 2018, among other things, granted the approval for the repeal of the Agricultural Marketing Corporation Act 1963 and the transfer of title and assets of the Agricultural Marketing Corporation to the Agro-Investment Corporation. The Cabinet also improved the issuing of drafting instructions to the Chief Parliamentary Council, as well as the amendment of the Agro-Invest Corporation Act. Madam Speaker, the Agro-Invest Corporation, formerly known as the Agriculture Development Corporation, was established under the Agro-Investment Act 2010, which was formerly the Agricultural Development Corporation Act 1952. The Agro-Investment Corporation Act was enacted in 2010 to give effect to a name change to the Agricultural Development Corporation Act in order to provide for the Agro-Investment Corporation in law. Madam Speaker, the Agro-Invest Corporation is very critical to the vision that we have for agriculture, and as we craft the new face of agriculture, focusing on agribusiness development. Madam Speaker, as part of this strategy regarding agro-business development, our agro-parks are critical, and they enable the cohesive engagement of factors such as production, land, labor, capital, and infrastructure, and zone in on increasing production and productivity over large contiguous acreages. That strategy under the agro-parks, Madam Speaker, falls to the Agro-Invest Corporation. The Agro-Invest Corporation currently manages 6 agro-parks and 1 agro-economic zone across 5 parishes, with an active farming population comprising of 15% of young farmers, 11% of female farmers, and in total 334 investors/farmers who now occupy 2,750 hectares. Madam Speaker, over the last 3 years, production across the agri-parks have seen a steady increase from 1.8 million kilograms in 2018-2019 to 3.3 million kilograms up to February of this year. And that represents, Madam Speaker, a 66% increase over the period and would have earned in value in excess of $731 million. So, Madam Speaker, it is critical that we not only continue the strategy, but that we strengthen the AIC, who is charged with managing these agri-parks. Additionally, Madam Speaker, as I said in my sectorial last week, part of what we're now doing is having the AIC take control of government land that is outside of the remit of the Ministry of Agriculture, but is good agricultural land, and bring those under the Ministry of Agriculture and regularize the arrangement with the farmers so that we can better provide extension services and better generate greater productivity. So, Madam Speaker, it's against this background that this bill is before us. Madam Speaker, the Agro-Invest Corporation plays an integral role in Jamaica's agricultural sector, and it has been on a drive to consolidate its efforts around the creation of a modern business model. Currently, the Agro-Invest Corporation is carrying the Agricultural Marketing Corporation as a charge on its budget. However, there is no evidence in the current Act that such a relationship has been established. It should be noted also, Madam Speaker, that the merging of the Agro-Invest Corporation along with the Agricultural Marketing Corporation is consistent with the drive of this government to rationalize our public sector entities, and is aimed at creating a more efficient and effective public sector by merging public bodies which share synergies of functions and resources. Again, the position is further justified on the ground that the Agro-Invest Corporation has been conducting the functions of the Agricultural Marketing Corporation since 2009. So the proposed amendment to the Agro-Invest Corporation Act will seek to increase the efficiency of the board in light of the expansion of the functions of the corporation, and will result in a better management of the corporation in accordance with the requirements of the Financial Administration and Audit Act and the Public Bodies Management and Accountability Act. The bill, therefore, colleagues, seeks to, 1, formalize the relationship between the Agro-Invest Corporation and the Agricultural Marketing Corporation by amending the Agro-Investment Corporation Act to entrust the functions of the Agricultural Marketing Corporation to the Agro-Investment Corporation and repeal the Agricultural Marketing Corporation Act. 2, to strengthen the effectiveness of the Agro-Investment Corporation by increasing its membership and diversifying the qualifications and skill sets of the members. And 3, further increase the functions of the Agro-Invest Corporation, including empowering the entity to mobilize and manage a pool of funds to be used to enhance the competitiveness of Jamaica's agriculture in the domestic and global markets. Madam Speaker, to go through the bill clause by clause. It commences with the long title, an act to amend the Agro-Investment Corporation Act to entrust the functions of the Agricultural Marketing Corporation to the Agro-Investment Corporation, to repeal the Agricultural Marketing Corporation Act, and to provide for connected matters. Clause 1 deals with the short title and construction, and the clause provides the short title of the bill and indicates how the bill is to be construed when read, and that is for the bill to be read as one with the Principal Act. Clause 2 provides an amendment to Section 2 of the Principal Act. This clause proposes to amend Section 2 of the Principal Act by inserting definitions for agricultural produce and functions. Clause 3 proposes to amend Section 3 of the Principal Act by deleting subsections 1 and 2 and replacing the foregoing subsections with new provisions. The proposed new subclause 1 establishes the body called the Agro-Invest Corporation, consisting of a chairman and a deputy chairman, and such members not being less than 7 nor more than 13. The proposed new subclause 2 stipulates that the members of the corporation, including the chairman and the deputy chairman, shall be appointed by the minister from amongst persons appearing to him to be qualified and who have experience in a profession, occupation, or discipline relating to agriculture, finance, administration, property management, procurement, accounting, auditing, or a profession, occupation, or discipline which the minister considers relevant to the advancement of the functions of the corporation. Madam Speaker, this is a critical change because before, the minister was very restricted in relation to the members that could be a part of the board. And as you have heard, the AIC has truly gone into management functions, especially of the agro-parks, and as such, you really need people who have the capacity, especially in things like property management, procurement, and prior to now, that was not provided for in the Act. Clause 4 proposes to amend Section 5 of the Principal Act, which deals with procedure and meetings of the corporation, at subsection 4 thereof by deleting the word 4 and replacing it with 7, which would now indicate that the quorum of the corporation shall be 7, including the chairman and the deputy chairman. Again, a major change, Madam Speaker, because prior to now, we were talking about a very small entity with a very small board, but as we expand in terms of the roles and responsibilities, it is important that the quorum be at least 7 members of the board. Clause 5 proposes to repeal Section 7 of the Principal Act, which deals with the appointment of officers and servants, and substituting it with provisions dealing with the appointment and employment of officers and employees. It provides that no salary in excess of the prescribed rate shall be assigned to any officer or employee, and no appointment shall be made to an office to which a salary in excess of the prescribed rate is assigned, except with prior approval of the minister responsible for the public service. It also provides that the prescribed rate shall be such rate as the minister responsible for the public service may be prescribed by order subject to affirmative resolution. It further provides that the Governor General may approve, subject to the conditions as may be imposed by him, the appointment of any officer in the service of the government to any office with the corporation, and such officer so appointed or so employed in relation to other rights as a public officer shall be treated as continuing in the service of the government. Again, important that as we seek to get the requisite personnel from across the public service, that people who come to serve at the AIC from other parts of the ministry are not made worse off. Clause 6, Madam Speaker, proposes to amend the Principal Act by inserting a new section 7A dealing with pensions, gratuities, and other retirement benefits. The clause provides that in relation to officers and employees of the corporation, with the approval of the minister with responsibility for the public service, may enter into arrangements or make regulations regarding schemes under insurance policies or otherwise. The clause also requires the corporation to make provisions for medical benefits, pensions, gratuities, and other retirement benefits, or disability or death benefits. The arrangements entered into or regulations made by the corporation may also include the grant of benefits to the dependents and the personal legal representatives of the officers and employees. Clause 7, Madam Speaker, deals with a repeal and replacement of Section 8 of the Principal Act, and this is probably the most critical change because this deals with the functions of the corporation, and it substitutes it with a new provision which also addresses the functions of the corporation. The proposed new Section 8 mandates the functions of the corporation, which includes, among other things, as follows. 1, to stimulate, facilitate, and undertake the development of agriculture in Jamaica. 2, critically, to mobilize and manage a pool of funds to be used to enhance the competitiveness of Jamaican agriculture in the domestic and global markets. 3, to finance select agricultural support services, including agricultural extension, research, marketing, and strategic information to producers and exporters of agricultural produce. 4, to provide grants for projects in the non-traditional agricultural sector. 5, to establish and maintain an efficient system of processing and marketing for agricultural produce by securing the most favorable arrangements for the purchase, handling, and exportation of agricultural produce. Again, critical, the vision of the AIC, Madam Speaker, is to ensure that it is generating investment in agriculture, hence a specific objective that it mobilize and manage a pool of funds to be used to enhance the competitiveness of Jamaican agriculture. Additionally, what we're doing in the agri-parks is to ensure that there is a link between the market and that which is produced. And again, this is specifically provided for under the amendment to the Act. The corporation is also charged with the functions to provide and maintain adequate marketing outlets for agricultural produce, to buy and sell agricultural produce, and to provide for the collection, transportation, storage, grading, package, and processing of agricultural produce. The corporation, subject to the Public Bodies Management and Accountability Act and the Financial Administration and Audit Act, may also receive contributions or donations of money or property of any kind from national or international sources, and is required to deal with such money or property pursuant to any trust, terms, and conditions imposed by the donor. The corporation may lend or advance money upon such security that is considered proper or without taking security. In general, the corporation can do all things it considers necessary or expedient to the purpose of carrying out its function. So again, Madam Speaker, you see the vision in relation to the alignment with the business approach to agriculture under this new Agro-Invest Corporation bill. Clause 8, this proposes to insert a new section 8A in the Principal Act to deal with the delegation of functions. Under this new section, the corporation is empowered to delegate any of its functions other than the power to make regulations and the power of delegation to any officer or employee the corporation considers fit. Such delegation by the corporation must be done in writing. The new Section A also indicates that any function that is delegated is revocable by the corporation, and such delegation cannot prevent the performance of that function by the corporation. So a few more clauses, Madam Speaker. Clause 9, this clause proposes to amend Section 9 of the Principal Act, which deals with borrowing powers, by deleting subsection 2 and replacing same with a new subsection 2. The proposed new subsection 2 prohibits the corporation from exercising any borrowing powers. It also prohibits the corporation from entering into negotiations or taking any other steps with a view to borrow money by way of the issue of bonds or other debt securities unless the amount to be borrowed, the source of the borrowing, the terms on which the borrowing is to be carried out, and any other aspects of the proposed borrowing is exercised with approval of the Minister with responsibility for finance. So it is not that the corporation cannot borrow, but it is so bounded that there has to be approval by the Ministry of Finance. And I think we all appreciate that that is good for public order. Clause 10, repeal and replacement of Section 10 of the Principal Act, and that deals with advances of grants to the corporation and guarantee of payment of sums borrowed, and it substitutes it with a new Section 10, which is somewhat similar to the repeal Section 10. The new Section 10, however, makes it clear that it is the Minister of Finance who may make advances and grants to the corporation out of any monies provided by the Parliament. It is also provided that the Minister of Finance, with the approval of the House of Representatives, by affirmative resolution, may guarantee on such conditions as he thinks fit the repayment of principal and the repayment of interest and charges related to any authorized borrowings of the corporation. In the event of a default in the repayment of any principal monies or payment of interest or charges, the Minister of Finance is empowered to direct the payment or repayment of the amount of such default out of the consolidated fund. Again, aligning the affairs of the government to ensure that the Minister of Finance sits in that central place regarding to what happens with the government's finances. Clause 11 seeks to propose to amend the Principal Act by inserting a new Section 18 dealing with regulations, and it gives the discretionary power to the corporation with the approval of the Minister to make regulations for the purpose of giving effect to the provisions of the Act. Clause 12 repeals the Agricultural Marketing Corporation Act. This clause also stipulates that regardless of the repeal of the foregoing Act, a reference to that Act in any enactment to specific provisions of the Repeal Act is to be construed as a reference to the equivalent provision of the Agro-Invest Corporation Act. Clause 13, this clause proposes to vest any property purchased by, belonging to, or vested in the Agricultural Marketing Corporation under the Repeal Act, or any property of the government vested in the Commissioner of Lands or the Accountant General, and occupied, utilized, or enjoyed by the Agricultural Marketing Corporation before the commencement of this current Act, and all interests, rights, and easements relating to the said property shall, without any conveyance, assignment, or transfer, belong to and be vested in the corporation. That is the Agro-Invest Corporation. And the foregoing is subject to all or any trust and to all debts, liabilities, and obligations affecting the said property. So again, the property that used to be controlled by the AMC would now, all of it would vest in the AIC. And the bill concludes with the memorandum of objects and reasons. So, Madam Speaker, I commend the bill to the House. We will suspend. I ask that the debate be suspended. I know my opposition counterpart may have a few points he wants to raise, so I ask that the bill be suspended, Madam Speaker. The debate, sorry.
The question before the House is that the debate on the Act to amend the Agro-Investment Corporation Act to entrust the functions of the Agricultural Marketing Corporation to the Agro-Investment Corporation, to repeal the Agricultural Marketing Corporation Act, and to provide for connected matters be suspended until the another sitting of the House. Those in favor? Those against? The ayes have it. The debate is suspended.
Madam Speaker, no further business is contemplated for today. I therefore ask that the House be adjourned to Tuesday, May 25, 2020, be adjourned to Wednesday, May 19, when the designated speakers in the sectoral debate, I said 25, so why somebody said? Madam Speaker, I don't know why some people are so disruptive. But there's no further business contemplated for today, and I therefore ask that the House be adjourned to Tuesday, May 25, 2021 at 2 p.m., when the designated speakers in the sectoral debate are the Honorable Dr. Horace Chang, Minister of National Security, and Mr. Hugh Graham, Member of Parliament for Northwest St. Catherine, and Spokesperson on Science and Technology. Madam Speaker, thank you.
Question before the House is that the House do adjourn until next week, Tuesday, the 25th of May. Those at 2 p.m. Those in favor? Those against? The ayes have it. This Honorable House is now adjourned.
Hello, Jamaica. My name is Patsy Edwards Henry, President of the Nurses Association of Jamaica.
I am Dr. Mindy Fitzenley, President of the Jamaica Medical Doctors Association.
And I am Dr. Andrew Manning, President of the Medical Association of Jamaica.
COVID-19 has wreaked havoc on our families, our communities, our livelihoods, and our general way of life.
Globally, over 100 million persons have been infected and more than 2 million have died.
Here in Jamaica, over 21,000 persons have been infected and close to 400 have died.
Thankfully, through proactive action, we now have access to a safe COVID-19 vaccine.
I will take the vaccine.
I will take the vaccine.